Okay, so good morning, everybody, and welcome to this workshop on the National Laboratory Quality Framework. We're very pleased to have you all here with us this morning, those of you who are physically present here and those who are joining us online. So we're actually live streaming the first day of this event. So before we move forward with the program of the day, I'm going to invite my colleague, Mr. David Lowen, who is going to give some instructions to those of our colleagues who are participating or joining us online on how to effectively participate in this session. Thank you. David.
Good morning, good afternoon, good evening, wherever you are. As Beatrice just said, I'm just going to give a couple of brief instructions for our group that's joining us virtually. What we'd like you to do is if you could please rename yourself in the Zoom application, and you can do that fairly easily by locating your profile. There's 3 dots right next to your picture. Click on that in the drop-down menu. It will say rename. Please just rename your either yourself or your group if you're joining with a number of individuals and the country that you're from. That will help us, be able to recognize you and understand where you're coming from, as well as later on in the Q&A session, which we will try to include after every presentation, time permitting. Please enter your questions in the chat box. And now that you've renamed yourself, we'll know who you are and we can select that question if appropriate, and that will be presented after each presentation. Any questions we're not able to get to today, we will address in the future, probably at some future a date in the next few weeks here, and we'll get those questions and answers out to you. So without further ado, we'll turn that back over to Beatrice.
Thank you, David. So before we move to our opening addresses, just a few housekeeping announcements. For our colleagues from the Francophone countries, Senegal, Cameroon, and Gabon, welcome. Their translation services, please access French translation services on channel 2. For the remainder of our colleagues, English translation is available on channel 1. So if we have any presentations in French or any questions, etc., from our Francophone colleagues, just put the microphones on and set your channel to channel 1, and you'll be able to hear the interpretation. Okay, and then also anybody who needs to use the bathroom facilities, it's to your back, please, through the doors. If you are unsure, please ask any of our administrative staff and they'll be very happy to help you. So with that said, let's start our program for this morning, and we're going to begin with our opening addresses. And to begin, we would like to welcome the CEO of ASLM, Mr. Nobile Ndlovu, to give us his opening address. Mr. Ndlovu, thank you.
Good morning and good afternoon, colleagues, ladies and gentlemen. It gives me great pleasure today to welcome you to this National Laboratory Quality Framework Workshop. I'm very excited to be seeing a number of familiar faces, and also very excited that there are also others that are joining us virtually. I want to start by recognizing the presence of the Fleming Fund, who are joining us, I understand, virtually. Thank you so much for joining, and thank you for trusting ASLM to deliver on this very important project that we are here to discuss. I also want to recognize the presence of the Africa CDC leadership that is represented here today by Dr. Aitenyo. I also want to recognize all the ASLM partners and friends who are here. Also, I want to recognize Patrick Mateta, the new ASLM board chair. He is here with us today. He's also the vice president of at CLSI. Also, Dr. Raiva Simbi, he's also here today. He's the SLM new board member, and he's the director of lab services in Zimbabwe. Let me also recognize Linda and Chad from DATOS. They've been with us throughout this journey of quality. Thank you so much for being here. And last but most importantly, I want to recognize the Ministry of Health lab directors that are here and their representatives. and also their country teams. Thank you so much for making time to come and be part of this very important workshop. We at ASLM can't be doing what we are doing without your leadership, without your trust, and also without your guidance. Your partnership with ASLM and your support to our programs is what gives ASLM the visibility and the credibility that we enjoy. So thank you so much for honoring our invitation today. It's been 10 years since ASLM, CDC, and many other partners, and including most of us that are here today, took the journey of transforming quality management systems implementation in Africa. I remember some of you here when we were together in the trenches, very familiar faces, moving from one training to another, from one audit to another, from one celebration of a lab being accredited to another, from one debriefing and some advocacy meetings with the permanent secretaries and the ministries of health. So we were all together, and I remember some of your faces that are here today. And over these years, we have accomplished a lot. Almost over 250 laboratories getting accredited across the continent. And in addition, we have created a grassroots movement on quality. So I want to affirm that ASLM remains strongly committed to be the leader and the driver of the quality management systems agenda and ensuring access to quality laboratory and diagnostic services across all the tiers. The emergence of COVID-19 and other re-emerging have put a heavy emphasis on the quality, and quality. The laboratory is now in the limelight, and so is the scrutiny on how the whole networks and systems are delivering quality results consistently and at any level of care to guide appropriate public health action. So we need to gather speed and build on previous experiences and achievements. While we have celebrated these achievements in the last 10 years, it is actually the next 10 years that is exciting us at ASLM. We hope you will catch this excitement in the next 5 days as we go through the program. What we would call QMS the next decade. The next 10 years that will see the solidifying of quality management system efforts into national policy and planning. The next decade that will see the quality management system efforts incorporated into countrywide, sustainable, and impactful approaches. No longer the project-based approaches happening in some sectors of the networks and not others, in some labs and not others, in public and not in the private sector, or vice versa. But the quality management systems being institutionalized, owned, and driven holistically by our governments. So to me, this meeting today is the first step of that next decade journey of the 10,000 miles. So moving forward, two things I would like to underscore today. Number one, networks and systems approach to quality management system, quality management system, quality management. Secondly, by national policy and infrastructure. This way, we will be able to ensure that, number one, the majority of patients that are treated at lower levels of the network have access to quality testing. Secondly, disease outbreak detection at these levels is reliable and can be trusted. And lastly, QMS is democratized and is available to all laboratories regardless of level and sector. I want to end with a quote by Edwards Deming. I quote, "You can only elevate individual performance by elevating that of the entire system." I close quote. So thank you so much for coming, and I wish all of us a very successful meeting. Thank you.
Thank you very much, Mr. Ndlovu. The success of ASLM would not be possible without the strong partnerships that we have formed with organizations. And we couldn't be prouder of the links and the partnerships that we have built with Africa CDC. And we are very proud today to be hosting this meeting in partnership with Africa CDC. We would like to invite Dr. Ayitenu Isheti to give the opening address on behalf of Africa CDC. Thank you.
Good morning, everyone, and thank you, Beatrice, for introduction. And dear Ndlovu, SLM CEO, dear Dr. Pascal, Director of Science and New Initiatives of SLM, dear participants, dear Fleming Fund team. On behalf of Africa Union and Africa CDC, on my behalf, I'm pleased to welcome you all this workshop on the National Laboratory Quality Framework, which is an important step toward this improvement or plan for improvement and implementation of a laboratory quality policy and planning, which is aligned with the African Health Strategy 2016 and 2013 policy framework toward this Agenda 2063. Lack of laboratory capacity is one of the major challenges contributing to delayed or inadequate responses to epidemic and pandemics. National laboratory systems have faced significant difficulties in advancing the deployment of laboratory quality management system at all levels of the laboratory network. This is due to lack of laboratory policy and strategic plan, or weak implementation, or inappropriate governance structure. However, despite all these challenges, many African countries have made progress in strengthening laboratory capacity and improving quality laboratory services. Still, Africa is facing a monumental task to prioritize, accelerate deployment of the laboratory quality management system. Africa CDC engaging Africa Union member states in collaboration with Africa Society for Laboratory Medicine and partners to strengthen their laboratory systems and networkings through the development and implementation of the laboratory strategic plan. There is a need for member states to develop and implement a comprehensive national laboratory policy and strategic plan that will enable coordination and integration of the laboratory assets in their country. Africa CDC continues and provide strategic leadership and guidance, coordination and advocacy, as well as oversees the technical support of the 55 member states through regional collaborative centers and partners. Africa CDC recognizes the good work that Africa Society for Laboratory Medicine has carried out the laboratory capacity building programs in Africa and inform the development of the national laboratory policy and strategic plan. I would like to take this opportunity to express my sincere thanks to the organizers of this workshop to advance the laboratory management implementation in the continent. I would also thank Fleming Fund to improve the lab capacity and diagnosis in Africa, I do also wish all distinguished participants from member states all successes with this workshop. I welcome you all once again and wish everyone a good time. Thank you so much.
Thank you very much, Dr. Ayetini. Last but certainly not the least, this meeting and our presence here would not be possible without the funders, the Fleming Fund, who is funding this, not just this workshop, but also the work and the activities that went into the development of the National Laboratory Quality Framework. We're very grateful for the funds and we're very grateful to the Fleming Funds for the funds that have been provided for us to strengthen laboratory systems throughout Africa. And to give the opening address on behalf of the Fleming Fund, we would like to invite Claudia Parry, who is representative of Mott MacDonald, who is the management agent for the Fleming Fund, and she's going to be joining us via live stream to give her address.
Hi, good morning, everyone. I'm going to share my screen, so please let me know if you can see it. So good morning. I hope you are all good and safe. I am Luna Parry, and I am the Regional Grants Coordinator at Mott MacDonald. So the Fleming Fund program, the Fleming Fund regional grants are funded by the UK Department of Health and Social Care and the Fleming Fund Grants Program. And the aim of the Fleming Fund is to address critical gaps in surveillance or antimicrobial resistance in low and middle income countries in Asia and Sub-Saharan Africa. And we are working in these regions because the countries in these areas are the countries that have the highest burden of antimicrobial infections. So the Mott MacDonald is the management agent of the Fleming Fund that we are responsible for the country grants, regional grants, and the Fleming Fellowship Scheme. So the regional grants program has grants in the 4 Fleming Fund regions: West Africa, East and Southern Africa, South Asia, and Southeast Asia. We have in the program 2 rounds of grants. Round 1, they are collecting retrospective antimicrobial data, and ASLM is they are holding 2 of the round 1 grants in West Africa and East and Southern Africa. And round 2 of regional grants aims to support the country grants by enhancing regional coordination and collaboration across quality assurance, quality control, regional data sharing, regional responses, and human resource laboratory capacity building. So within this context, in 2019, ASLM and consortium partners were awarded a regional grant, EQuAFRICA, and they have been working across 14 African countries, mainly Fleming Fund priority countries. And this grant was set up to strengthen pathogen identification, antimicrobial susceptibility testing. And EQuAFRICA have been providing ongoing on-site and remote technical assistance and mentorship to national referral labs across these 14 target countries. We at Mott MacDonald are very proud, absolutely proud of the work that ASLM and consortium partners have done, and not just in EQuAFRICA, also in the other regional grants that they are holding. And this fantastic work has been inspired a global pandemic. So we can't be prouder, as I said. And there are just here some achievements that I want to highlight today. This is not all, but it's just the main ones. So they have, for example, established a regional AMR EQA program. They have run 2 cycles and they're running a 3rd one now with more than 70 participating labs from 14 countries. They are delivering capacity building, training. These courses have been delivered across the 14 countries on animal health and human health, which have benefited more than 200 participants. Even more impressive, they established a community of practice which has more than 150 laboratory professionals taking part of the sessions. And finally, and what is gathering us today, they developed the National Laboratory Quality Framework Blueprint Guideline, which we know is going to be a key tool to guide countries in developing and strengthening their national laboratory policies. So on behalf of the Fleming Fund, I just want to say to ASLM and consortium partners, well done, and thank you for this opportunity today. Thank you.
So our first presentation this morning is going to be given by Dr. Pascal Ondoa, who is the Director of Science and New Initiatives at ASLM. And the title of the presentation is Introduction to the Purpose and Principles of Laboratory Quality Management System. So Dr. Ondoa's presentation is really going to set the stage for why we developed the NLQF. Dr. Ondoa, please.
Good morning, everyone. I hope that everybody is well. So let me start by saying how much of a pleasure it is to meet with you again. 3 years, I think, after the initial meeting that we had in Johannesburg, when we discussed how we could make external quality assessment program for antimicrobial resistance more effective in Africa. And at that time, from the 14 countries that participated and the stakeholders, we really came to the conclusion that having enabling policies and overall enabling system for EQA to be effective would be the way forward. So 3 years after that meeting, we are here again to present some of the key intervention that we would like to implement for EQA. So you will see that I slightly changed the title of this presentation, and I will talk about the situation of quality management system implementation and ISO 15189 accreditation in sub-Saharan Africa, because I think that this really will set the stage and explain why we are here today. And to start, I would like to say that I am not a quality specialist. I am a laboratory expert, and I implement programs and all sorts of intervention in Africa. And I really can see quality as a tool to help us having better diagnostic. And this is why in the early years of my career, quality was actually such a boring topic to me before I understood how powerful it can be to strengthen our laboratory system and obtain better patient and network functionality. So let me try not to bore you with a talk on quality, but really share some thoughts on where we came from. So the outline of this presentation will go from some history of QMS and accreditation, some definition, what is the advancement of ISO accreditation in sub-Saharan Africa, what are the outcome of the SLIPTA program after 10 years of implementation. The SLIPTA program has been a flagship activity of ASLM, and I think it is very good that we can reflect on what happened, what went well, and what went less well. And what is the significance of the level of QMS advancement in sub-Saharan Africa? And finally, why are we here today? So the first question around which I would like to articulate that talk is why did quality management system and accreditation become such priorities for laboratory? And if we go a little bit back in time, well, actually not a little bit, but like 20 years ago or more. So back in the years 20, actually the late years 20, there were a global effort to control the HIV, tuberculosis, and malaria epidemics. And really all the stakeholders came together. And you will hear or you will read in most of the articles that talk about strengthening laboratory system and diagnostic. You will read that 70% of clinical decisions are based on laboratory results, which really puts the laboratory in the middle of of global health, clinical health, and public health. So how quickly can we, or could we at that time, address the weaknesses of laboratories in sub-Saharan Africa? So it was really about to improve the clinical and public health outcome around those three main programs, and we had to come with a quick solution. So at that time, in those years 2000, there was a series of very powerful decisions, resolutions, and guidance from the global and regional stakeholders. So to name a few, in January 2008 in Maputo, there was a general framework to strengthen the laboratory systems, and it was even says integrated laboratory system. In April of the same year, in Lyon, there was another meeting where it was discussed that low and middle income countries had to consider a stage approach to quality management system. So we know that the accreditation is a yes or no, but it was considered to be very difficult for the countries to attain that, hence the stage approach. In the same year, in September in Yaoundé, there was another meeting and they discussed how to strengthen laboratory at all levels and mobilize the resources to do so. And finally, the following year, in July 2009 in Kigali, that framework for the stepwise process toward accreditation was adopted. So in this discussion, there were several tools and programs that have been developed in order to push the agenda of this stepwise advancement to QMS implementation and accreditation. So you will see on the left, you see the SLIPTA program, the stepwise laboratory management toward accreditation is really the tool or the program that gives you the how to implement the QMS. And it's a structured quality improvement program that is designed for low and middle income countries. Then in order to understand how far facilities are with implementing their QMS, the SLIPTA, the stepwise laboratory improvement toward accreditation, have been designed and developed, and it benchmarks, it's a checklist, it benchmarks the advancements of QMS in a stepwise manner. And actually, when it was designed, the idea around it was to have a temporary alternative to accreditation in low and middle income countries. And there's a certificate that is assigned by an official committee. So often SLIPTA and SLIPTA are used interchangeably, but they are by essence very different. Then we have the LQS side, the laboratory quality stepwise implementation. It's a kind of do-it-yourself, a DIY. So for people that have enough knowledge about quality management, but they want a little bit more guidance on how to do it, they can use this online tool that is for the stepwise implementation of QMS, and not only in clinical laboratory, but also in public health laboratory. So there are, of course, other tools and programs, but this one, I wanted to highlight them because they really came in the middle of these powerful decisions to implement a stepwise approach. So let's go back to some definitions. What is a quality management system? It's a system through which the laboratory manages the continuous quality improvement of its operation, from the pre-analytical, analytical to post-analytical phase of the testing. And QMS can be built against different standards. It is not something that is specific to laboratory, but the standards for medical laboratory is the ISO 15189. And what does that mean for medical laboratory? It means that tests are being produced to manage patients. That's in a nutshell what it means. Then what is a certification? It is a written document that is delivered by a third party that the laboratory has the QMS in place based on the verification of conformity, and the key word here is conformity. Conformity to some quality standards, for example, the SLIPTA certificate is one of those, and the certification encompasses the whole organization, the whole laboratory. And finally, we have accreditation, and sometimes certification and accreditation are used interchangeably, but they are different. Accreditation is a formal recognition by an authoritative body that the laboratory has the appropriate QMS in place and is competent to perform the test according to the standard. Accreditation covers specific tests. We call that the scope of accreditation. So QMS and accreditation are actually meant to support improved outcome and are part of a bigger picture. And it's easy to then start to concentrate on the technicality of QMS and accreditation and forget that it is actually to improve the health outcome. And some very interesting quotes on quality have been made. And for example, Johan Cruyff is a Dutch football player that is very famous, that some of the older people here in the crowd may have known. And he said quality without result is pointless. So it means that if we implement quality, but we cannot achieve improved patient, clinical, or public health result, we are not doing our work. Then there is a word from John Ruskin. He's an English philosopher and writer, and he said quality is never an accident. It is always the result of an intelligent effort, and there must be the will to produce a superior thing. And he really refers to quality is not only the business of the quality officer in the lab. It is the business of everyone in the facility. It is even the business of many people in the government that can actually enable these advancements to a quality management system or accreditation. And finally, a Filipino lawyer and politician, Francis Esquerdo, he said implementing a universal health coverage plan without making sure that there is enough facility and quality health worker means spending a lot of money with little chance of better health result, especially for the most marginalized sector of the society. And that's really why we are here today. A lot of resources and investments are made into this quality management system and accreditation. But are we making sure that all the systems around are in place so that it is successful and that we indeed make an impact on health outcomes? So how far are we with ISO 15189 accreditation? And I would like to share some of the results that we analyzed from the year 2020. So you would see on the left the list of accrediting bodies that are affiliated to ILAC and that are delivering the ISO 15189 accreditation in the WHO Afro region. So we listed 17, and some of them are based on the continent and some of them are even international, but they still deliver those accreditation certificates to the WHO Afro region. So we went to the website of those accrediting body, and what we could see for the year 2020 was that 668 laboratories from 26 countries of the WHO Afro region were accredited in 2020. And 45% were from South Africa. I think the next country with the most laboratory accredited was Kenya. 0.6% were from Central Africa, and 5.7% were from West Africa. So we can see already some mixed results of accreditation on the continent. Less than 6% of accreditation are delivered for molecular biology, virology, and tuberculosis testing. Although those topics are really the one that come back a lot when we discuss about laboratory and diagnostic on the continent, these are topics that are very scarcely accredited on the continent. And interestingly, for some countries that have a national accreditation body, they recorded very few accreditation from their own country, which actually illustrate that there is even internally in some country some problem where the resources are not used in the way they should. So what does that mean, those 668 accredited laboratories? What does that represent? It represents 1.1% of laboratory in the public sector in the 26 countries. So when you count all the medical laboratory from those 26 countries, a very small percentage are accredited. So what does that mean? If I come back to the introduction talk of Mr. Ndlovu, most tests that are returning to patients are not quality assured, or they are not coming from a setting that has some strong quality management system in place. 27% of those 668 labs, they have never been using SLIPTA. 17% have never used the SLIPTA, and that's not wrong in a way. You can go to accreditation without using those tools. But it really poses the question of how much those tools contribute to accreditation. And finally, the number of LQSI users that the WHO was so kind to share with us, it did not correlate with higher number of accreditation in a particular country. So could LQMS tools and programs, SLAMTA, SLIPTA, and LQSI, could they contribute better? And what is missing so that those programs actually are more effective to promote accreditation? So the second question I would like to discuss with you is how far we are with the SLIPTA program. And we also share that overview from 2020. And we were privileged at ASLM because we keep record of what is going on that program. So we studied the SLIPTA outcome of 475 laboratories that ever were engaged in the SLIPTA program between 2013 and 2020. So you can see that first bar represent the 475 laboratories, and you can see that 92 in the first 24 months actually reached accreditation. So the SLIPTA program, just to remind you, is actually a program that is a maximum of 6 years. And every 2 years, there should be a follow-up audit. When you look at what happens at 24 months, you see that a lot of laboratory has dropped and that many of them do not go for a follow-up accreditation, a follow-up audit. You can see that laboratories still reach accreditation, but a lot less than the one that reach accreditation in the first 24. And then it goes down until the 72 months, which is the maximum of 6 years where a laboratory is in the SLIPTA program, where you have only 35 laboratories staying. So what are the main observations? The majority of labs, they use SLIPTA as a one-off exercise. And most, they do one audit, and then they do not continue. And the likelihood of achieving accreditation is actually low in general, but is the highest within the first 24 months. The overall percentage of accreditation is 23% among the SLIPTA laboratories. And in the lower tier, initial low SLIPTA performance and lack of improvement are associated with not achieving accreditation among those laboratories that are engaged with SLIPTA. So these are very important observations after 10 years of running the program. And so there are some reason or some perception why QMS, not only the SLIPTA, but QMS tools in general are not really leading to the accreditation process or are not being sustained. So from the users, which means the lab managers, the people working at the facility, they say, well, there's no institutional support from our Ministry of Health. There is a lack of national quality standard to institutionalize QMS implementation at all tier levels. So most of the time, reference laboratories manage, but at lower level, it's a lot more difficult. The ISO requirements are not achievable in intermediate and basic laboratory with less resources. So if you just have like a microscope or very basic laboratory function, it is difficult to really go through the process. Other people think that insufficient guidance on testing method and quality improvement are actually included in the tool. And finally, some people say that quality does not improve health outcome. Yes, indeed, if you implement in a suboptimal way, there will not be a visible benefit for the patient of the public health. Now, from the provider, which means us at ASLM or other implementing partner that provide technical assistance, what we notice is that donors have somewhat dropped QMS from their priority. It seems that system strengthening is not really glamorous. It takes a long time to have results, and therefore the funding is less attractive to fund this kind of area. There is a lack of institutionalized support to the SLIPTA Secretariat. We are sometimes, for the SLIPTA, really feeling a little bit alone. There's a lack of collaboration between international QMS initiative, and you can see that sometimes tools are being reshuffled, redone, instead of using the ones that are proven to give the best results. There is an insufficient vision of QMS as a laboratory network function and as a country policy. I think this comes back to the words of Mr. Ndlovu. An accreditation body and MOH do not speak to each other. And I heard from a colleague that although one country has an accrediting body, they never speak to the Ministry of Health, and you see very few facilities in that country being accredited. So what does that mean, this low advancements of QMS at the continent level? Some of you may know the joint external evaluation tool of the WHO that is supposed to really assess how far countries are for their global health security package, but that also has consequences for clinical diagnostic. And when you look at the results between 2017 and 2019, I think from 48 countries of sub-Saharan Africa, 68 of those countries have no or limited capacity in terms of laboratory quality system. For those of you who know the tool, is the D14 indicator. So that means the question refers to national standards in place or enforced. And so it means that in almost 2/3 of the country, there is no national quality standard in place or enforced. And this is 14 years after the Maputo Declaration. So there are consequences on IHR requirement and, of course, outbreak preparedness, in addition to the fact that very few tests are coming from settings that implement QMS. So what are the lessons learned, and what is the rationale for national quality policy? So what we can see is that the past decade has established a solid foundation for QMS. Although some of the results are worrisome, I think there is a broad awareness of what QMS should be and why accreditation is important. So I think that we should continue to build on this. But translating this initial achievement into improved patient and public health outcome, they require more. They require to transition QMS from what happens at the facility level to the network level. And this is a change in scale, and it requires a systems approach that is anchored into national quality policy and infrastructure that is owned by the country and that is linked to enforcement mechanisms and adapted resources. So at this point, I would like to thank you, and I hope that you enjoyed going back into the history of QMS and accreditation in sub-Saharan Africa. And I hope that the next presentation are going even to further highlight why we are here today. Thank you very much.
Thank you very much to Dr. Ndoa. So before we move on to our next presentation, we're going to please just take about 2 minutes to deal with some technical issues, and then we'll come back for our next presentation. Just a reminder, whilst we're trying to resolve the technical issues, for those of you who are joining online, after the next presentation will be broken into two. There will be a short tea break in between. We kindly ask that please make sure that you're putting your questions or comments into the chat box, into the space provided for you to do so on the live stream. And we will be monitoring those questions, and we'll be fielding some of those questions during the question and answer session in approximately half an hour to the presenter. So if you have any questions on any of the presentations or the addresses that have been given so far, and including what is to come next, please start putting your questions and comments into the chat box. Thank you.
All right. Good morning, everybody. Good morning, good afternoon to everybody listening in online. Thank you very much, Beatrice. So in this presentation, there's a bit of an echo on the line. That can be resolved. So in this presentation, I will go into a bit more detail on quality management systems, the basic principles of quality management, and also look at what has happened in the past decade on this continent in Africa with regard to the implementation of quality management systems. So my name is Chair Datema. I'm an advisor, trainer, consultant, advisor, laboratory strengthening at DATOS, of which I'm also the CEO. DATOS is an organization focusing on laboratory strengthening worldwide. I'm here with my colleague, Linda Oskam, also trainer, consultant, advisor, lab system, laboratory system strengthening, and co-CEO of DATOS. During this presentation, I will also give the floor to Dr. Samba Diallo and Teferi Mekona. Samba Diallo is a laboratory senior advisor at Africa CDC and ASLM, and at Teferi Mekona is GHSA program manager and SLIPTA coordinator at ASLM.
Ladies and gentlemen, please, if any of you are joining the live stream on your computers, please make sure you're on mute. Could you kindly make sure you're mute? The echo is coming from somebody's laptop.
Just also a side note, I see a lot of people making pictures with their phones of the slides, which is totally fine, but please note that at the end of the workshop, you will receive the presentations as well, the handouts of the presentations, also in French. They have been translated into French. They will be made available to you at the end of the workshop, so don't be afraid to miss out. Feel free to take pictures if you want, but please know that you will get the slides. Am I in presentation mode again? Yes, so the objective of this workshop, I don't see the English presentation. So, that's a rather rough start, but hopefully now everything goes smoothly. So this week, the objective of this workshop is to assist the 14 African Fleming Fund countries to initiate implementation of the guidance for establishing a national laboratory quality framework, or in short, NLQF guidance. But before we start with that, I just want to give you a bit of a background overview of, in more detail, of what is quality management, what have we done in the past decade on the implementation of quality management system, and extract lessons learned from that. So why are quality laboratory services important? Well, because diagnostic decisions based on clinical symptoms alone have a poor reliability. This has been shown by a lot of different studies, among others. Rayburn and colleagues showed that of 4,670 patients admitted to hospitals and treated for malaria, only 50% actually had malaria confirmed by blood smear. And many studies present similar data. And this leads to both undertreatment and also overtreatment of diseases. And of course, that in turn leads to an increased disease burden and suffering, but also to a waste of resources. So laboratories provide the empirical data needed for medical decisions. Actually, as Dr. Ondoa also already indicated, laboratory services influence at least 70% of medical decisions. And I put there at least, because this is a statistic that was published in the 90s, and you can imagine in a rapid developing field as laboratory sciences, with a lot of new technologies following each other up, this number will have increased rather than decreased. So this is the view from a patient care perspective. But laboratories are also important, quality laboratory services are also important for public health, for monitoring disease patterns. They are essential for early detection of disease outbreaks, and they enable evidence-based decision-making for containment of diseases. We have all seen the examples of this in the past 2 years, and I think the whole world will now agree that this is true. So they are important for compliance with international health regulations and other global health initiatives and regulations. Laboratories, as we always say, are the eyes and ears of the health systems. So how do we ensure quality laboratory services? Well, through implementation of a quality management system, or QMS, based on international standards. Now, going again back into the past, how did this evolve? When we started doing our work, when laboratory science started, at the start of the laboratory testing, we had nothing arranged with regard to quality. We just did inspection. And inspection is something that everybody does consciously, but also subconsciously. When you tie your shoelaces and you make a mistake, you notice this, which means that you've probably been inspecting your work. And the same happened, of course, when you were working in a laboratory. If you're working in your laboratory, you're doing your work, you are inspecting your work. But that nothing there is standardized. At some point during the 1950s, 1960s, we actually started to structure this a bit better. We started to implement quality control. These were fixed steps in the process, in our laboratory testing process, to check the quality of our work, to check whether the output of our work is meeting our expectations. And quality control also includes external quality assessment, or EQA, which also started around the 1960s. Sending around panels to laboratories, testing those panels, sending the results back to the organizer of the external quality assessment scheme, and checking the output of the performance of this laboratory. Later, we also started to think, how can we increase the chances that our work is meeting quality expectations? What can we do to prevent mistakes from happening? And we started to think, well, let's preventatively maintain our equipment. Let's document our laboratory testing procedures in standard operating procedures. And these were called quality assurance measures. You assure the quality of your work. It's called quality assurance. Now you can imagine that quality control and quality assurance involve a lot of different activities in our laboratory work, which have to be managed, which have to be organized and managed in a system. And that is the quality management system. A quality management system is a system for continuous quality control, assurance, and improvement. And the ISO 15189 is the international standard for quality and competence of medical laboratories. This standard lists the requirements to a quality management system in a medical laboratory. And if a laboratory complies with this standard, with these requirements, they can apply for accreditation, international accreditation. So, to summarize, laboratory quality management ensures simply that laboratory services provide the right test result at the right time, on the right specimen, from the right patient, with the right test, at the right price, with the right result interpretation, based on right reference intervals. So after these basic principles of quality management and quality management systems, I would like to look back at the past 10 years, or they are now past 12, 13 years of QMS implementation in Africa. What has been done? And for that, I would like to give the floor to Dr. Samba Diallo first, who will give this from a perspective of international accreditation. And after that, Dr. Teferi Mekonnen will provide an overview of the SLIPTA accreditation process, which has been rolled out largely in Africa. Dr. Samba, the floor is yours.
Good morning, everyone.
So that our French-speaking colleagues can also enjoy a live event without headsets. So, after the presentation of Tjeerd, I would like the main, such as Toyota and Ford. This is what they started. They wanted to enhance their quality and efficacy. So it was in the 20th century that this concept of management system came to laboratories, health laboratories, so that we could generate quality results.
Toujours dans le sens de ce rappel, il est intéressant de vous parler de l'infrastructure qualité, qui est un ensemble de systèmes qui va permettre au pays, à une région, à tout un continent de réaliser des objectifs, en tout cas les objectifs qualité à tous les niveaux, et surtout pour la satisfaction des clients. Et donc, l'infrastructure qualité, vous noterez que c'est un système qui comporte au moins 7 éléments, dont le premier, c'est l'établissement de la politique qualité. Ensuite, la normalisation. Vous avez tout ce qui est en rapport avec le cadre technique et réglementaire, l'évaluation de la conformité, l'accréditation, la métrologie et la promotion de la qualité pour son utilisation. Et donc, ce qui fait qu'au niveau du système, au niveau de l'infrastructure qualité, il y a d'abord au niveau national. Et au niveau national, nous devrons établir un système pour l'établissement des normes. Nous devons également avoir notre système d'accréditation et de certification de nos formations sanitaires, avoir tout ce qui est en rapport avec la méthodologie et autres. Et cela doit se refléter au niveau régional. Par exemple, si vous prenez la CEDEAO ou alors l'Afrique de l'Est, l'Afrique australe, chaque structure doit avoir son infrastructure qualité. Et ensuite, au niveau de l'Afrique, ces infrastructures qualité devraient se retrouver dans ce que nous avons appelé ici, au niveau de Africa CDC, vous avez AFRIMED pour ce qui est de la métrologie. Et nous avons l'AFRAC, qui est la coopération d'accréditation pour l'Afrique. Et ensuite, bien sûr, ARSO, l'organisme de normalisation. Et cela va ensuite permettre de les rattacher au niveau international avec, bien sûr, pour le système des laboratoires, avec IAF. Et l'intérêt d'avoir cette infrastructure qualité, c'est de soutenir tout le travail que nous faisons en donnant une confiance globale à ce qui est donné comme résultat. Et donc, un des intérêts majeurs, c'est lever les obstacles techniques au commerce. Comme si vous vous rappelez, je vous ai dit, la qualité est rentrée par l'industrie. Donc, permettre de commercer, permettre la mondialisation et l'échange des produits. Et ce qui va permettre également une reconnaissance, un accord de reconnaissance mutuelle. Ce qui veut dire, à un niveau donné dans un pays, lorsque l'organisme d'accréditation est reconnu et affilié à IAF, cela permet que lorsqu'il vous délivre un certificat, une attestation, vos résultats seront immédiatement reconnus par tous les autres signataires de cet accord de reconnaissance mutuelle. Là, je vous traduis ce que j'ai dit tout à l'heure en parlant de l'infrastructure qualité. Il y a d'abord la politique qualité. Au niveau africain, il y a ce document qui existe au niveau de l'Union africaine. Et ce document, dans un premier temps, est bien sûr relatif à la qualité, mais bien sûr portant sur l'industrie et le commerce. Et ce document, normalement, doit être décliné en politique qualité au niveau régional. Par exemple, quand je prends l'Afrique de l'Ouest, vous avez la politique qualité de l'Afrique de l'Ouest. Et on devrait avoir également la politique qualité pour l'Afrique australe, l'Afrique de l'Est et au Nord. Et ces politiques devraient normalement être déclinées en politique qualité nationale au niveau d'un pays. Et c'est là, je vous ai pris l'exemple de l'Afrique de l'Ouest, où vous avez les pays qui, en 2012, a élaboré leur politique qualité et cela continue toujours. Comment cela se reflète au niveau santé? Au niveau santé, nous avons notre document de base qui est à l'honneur aujourd'hui, ce cadre qui nous permet de développer les politiques qualité. Le document, c'est une initiative continentale. Ça va permettre en tout cas de consolider la politique et de telle sorte que les efforts en termes de qualité se ressentent au niveau national et également au niveau de la planification de la qualité. Et c'est une approche, bien sûr, qui va se faire à l'échelle du pays. Vous comprenez tout de suite que nous sommes en train de quitter du simple activité que nous menons dans les laboratoires et comme mes prédécesseurs l'ont dit, pour nous étendre dans tout le système, dans tout le réseau, au niveau du pays, pour que de manière efficace, les résultats puissent être fiables et en tout cas dignes de foi dans les différents laboratoires. Et donc, une fois que vous devrez être amené de manière pratique comment utiliser et mettre en œuvre cette politique dans ton pays. D'abord, c'est de faire le point de la situation. Est-ce que dans mon pays, j'ai une politique nationale en matière de laboratoire ou alors une politique qualité pour les laboratoires? Et alors, on se pose la question, est-ce que le document est en place? Si le document est en place, si le document n'est pas en place, c'est d'utiliser ce document-là, parce que quand vous allez voir dans les détails dans ce document, vous allez avoir des exemples pour vous aider à mettre en place votre système de management. Disons, donc d'écrire votre document et donc vous allez bien sûr suivre les pas à pas ce que ce document recommande, mais également n'oubliez surtout pas de prendre en compte les exigences nationales, parce que dans nos pays, chaque pays a ses exigences et il faut arriver à aligner ces exigences avec ce que ce document dit. Lorsqu'il se trouve que dans le pays, il y a déjà une politique qui est en place, donc l'orientation, c'est de mettre à jour votre politique en tenant compte des orientations que ce document nous donne. Et ce document est à l'échelle africaine. Et il est important pour que tous les pays membres de l'Afrique puissent l'adopter. Et en tout cas, on pourra avoir un système pratiquement harmonisé dans tous les pays. Et donc également, pour mettre en place la qualité, il faut noter qu'il y a eu beaucoup de régulations, de déclarations et d'orientations qui ont été données. Parmi ceux-là, bien sûr, Dr Pascal Ondoa est revenu sur un certain nombre de points, notamment bien sûr la déclaration qui a eu lieu au niveau de Lyon. Il s'agissait de procéder à une approche progressive dans la mise en œuvre des activités qualité pour aller vers l'accréditation. Et bien sûr, avec la déclaration de Maputo, où il a été question de renforcer le système de laboratoire dans les pays et avec celle de Kigali qui a permis de lancer le système, le processus graduel de gestion de la qualité dans les laboratoires, ce qui est appelé SLIPTA. Et bien sûr, en 2011, le cadre de mise en œuvre du processus graduel d'amélioration de la qualité dans les laboratoires, appelé SLIPTA. Et cet outil, bien sûr, vous permet de faire une évaluation de base, de mesurer le progrès et en tout cas de voir à quel niveau, jusqu'à quel point je suis prêt pour aller vers un organisme d'accréditation. Ensuite, on a parlé de normalisation. Cette normalisation, dans la pratique, comment ça se passe? Vous noterez que dans les pays, on doit pouvoir développer ce qu'on appelle nos normes et nos référentiels de qualité qui doivent s'appliquer à nos laboratoires. Et ce qui est intéressant, quand vous regardez le réseau de laboratoires, ce référentiel doit s'appliquer, par exemple, on doit avoir un référentiel dédié pour le niveau 1, un référentiel pour le niveau 2 et un référentiel pour le niveau 3. Et là, ces normes, dans certains pays, surtout dans les pays francophones, nous avons ce qu'on appelle le guide de bonne exécution des analyses. Et ensuite, les pays doivent développer. Mais dans la pratique, quand vous allez dans les pays, les normes au niveau national ne sont pas développées. Tout le monde est en train d'utiliser la 1589 pour les normes de laboratoire. Et donc, normalement, quand on met en place une norme nationale et qu'on atteint un niveau qui est acceptable, qui est bon, on est prêt, on peut être invité à mettre en place une norme internationale. Et la norme internationale dédiée pour les laboratoires, c'est la norme ISO 1589 qui va donner les exigences particulières pour la qualité et la compétence dans les laboratoires. Et une fois que, et généralement dans la pratique, il est conseillé que les laboratoires de référence et les laboratoires de niveau 3, en tout cas très élevés, aillent directement à cette exigence-là pour que, bien sûr, des services de qualité soient rendus aux populations et également aider à la prise de décisions cliniques, mais également prendre de très bonnes décisions de santé publique pour la gestion des différentes épidémies. Et donc, quelle reconnaissance externe peut-on prétendre? Lorsque nous mettons en place une norme au niveau national, en principe, on devrait pouvoir bénéficier de ce qu'on appelle la mise en place d'un programme de certification qui va permettre de reconnaître ce qui est fait localement. Et j'ai dit bien certification parce que dans ces pays, lorsqu'on met en place ces organismes pour la reconnaissance externe, l'évaluation et la reconnaissance externe de la conformité ou de la compétence, ce ne sont pas des structures qui sont accréditées
can see, it is,
Et
you
donc,
have
lorsqu'il
these
s'agit
in
de la mise en
countries,
place
but
d'une
they
norme
are not
internationale,
recognized
c'est clair
internationally. So
qu'on
when
peut
you do
prétendre
it at
à une
international
accréditation
level, and
internationale
you have
par un
ISO
organisme, bien sûr, accrédité.
15189, it is sure that
Et
you
pour
can
faire cela, bien
move
sûr,
towards
dans les
accreditation.
laboratoires, il y a
And to
aussi,
do so in
c'est-à-dire, il y a une
laboratory, we
organisation
also,
internationale
there is an
nationale,
international,
et maintenant du national, nous rentrons dans le laboratoire.
so you
Et donc,
have
pour
the
faciliter
international,
la mise en
regional,
place du
national, and
système
then
de
your
gestion de la
laboratory.
qualité
So
dans les
to
laboratoires,
put in
des
place
outils ont
these
été développés pour encadrer et
QMS,
faciliter cette
we
pratique. C'est dans
also
ça,
have
par
the
exemple, quand
following
vous
tools that are
regardez dans les
used
laboratoires
to
de
do
tuberculose,
so
il y a eu
and improve the quality
l'initiative
of diagnostic services. For
GLI pour les
example,
labos.
you have the
Ensuite,
GLI
le système
initiative
de
for
gestion
tuberculosis, and then you
le système
also
de gestion
have
dans les
the
laboratoires pour
lab
l'accréditation,
management
mais
for
également au
accreditation,
niveau de l'OMS,
but
il y a
also
un
at
autre outil qu'on a appelé le système
WHO,
basique
you
de
have
de gestion de la qualité qui permet
tool
pas à pas
for
de comprendre le
management
système
quality
de
that
management
enables you
de gestion de la
step by
qualité
step
et de
to
mettre en œuvre
understand
dans nos
how
laboratoires.
to
Et aussi, nous avons eu
manage
l'outil
quality
SLIPTA
in
qui
laboratory. And
permet
you
aussi,
also
comme
have
je
the
l'ai dit,
framework
les
SLIPTA,
évaluations, la mesure du
and
progrès pour
that
ensuite
enables
impulser
us to
l'amélioration
measure
dans notre pratique.
progress. And I
Avec
will
bien
remember
sûr
you
l'autre
SLIPTA
outil
is strengthening
de
laboratory improvement
LQSI qui
towards
permet aussi
accreditation,
à chaque
and
labo
then
de pouvoir
you
l'utiliser
have the
étape par
LQSI
étape
tool,
pour mettre en
which is a
place son système de
stepwise
gestion de la
plan for
qualité.
implementing
Et une fois que nous avons mis
QMS.
en place
Once
le
you
système de
have
gestion
these
de la
tools
qualité,
in place
il est question de
for
parler
QMS,
d'accréditation et de
then we can
certification.
speak about
Je ne vais pas me
accreditation and
répéter parce qu'il y
certification.
a
I'm not
Dr
going to
Ondoa qui est
repeat
revenu sur la définition
myself,
de
as
l'accréditation,
Dr. Ondoa
qui
already
en tout cas
mentioned the
permet
definition of
à une structure
accreditation,
de
which
démontrer
enables
sa
a
compétence
structure
à
to
réaliser une tâche
illustrate
particulière.
and to
Et cela
his
signifie que quand
competency
nous
or
sommes
to
accrédités,
demonstrate his
ça veut dire
abilities
nous
to
sommes
do
compétents,
different
nous avons
tasks.
démontré
So
notre
it
compétence.
is
Et
now
donc
when you are
l'accréditation
accredited,
est
you
une
demonstrated
attestation
that
de
you are
compétence.
competent.
Et notez que
And
l'accréditation,
also, please
dans le
know
cas
that
ci,
accreditation,
elle est internationale
that this
et elle est
accreditation is
accordée par un
international
organisme d'accréditation
and is
après une évaluation
delivered
tierce partie.
by an
Et notez que
accreditation body
selon les
after
organismes
an
d'accréditation,
evaluation.
la validité
And
d'un
the
certificat
validity
va de
of
2
your
à 5 ans.
certificate
2 ans,
is
pourquoi?
from
Parce
2
que souvent, les structures
to
sont
5
jeunes.
years.
Les structures qui sont
Why?
jeunes
Because
dans l'accréditation mettent un cycle de 2 ans pour permettre
have a
de
cycle of 2
réaccréditer et de
years
se
so
faire
that
la
we
main.
can
Et les structures qui sont vraiment anciennes
reaccreditate
dedans,
and that you can
font
keep
à
up to
5 ans.
date, of course. So it
Et donc la
goes from 2 to
certification,
5
la
years.
définition, vous l'avez
And the
déjà, là
certification,
c'est
well,
notre
the
capacité
definition, of
à
course,
être
is
conforme à un certain nombre
to be
d'exigences qui auraient
conformed to
été
different
édictées par des
requirements,
standards,
to meet
ça peut être
specific
national ou
requirements.
alors international.
This is the
Mais dans
procedure
ce
by
cas-ci,
which an
je parle de
independent body
certification parce que
provides a
j'ai eu
written
à parler
assurance
de
that the
normes
target
nationales.
service
Et
or
donc,
system
au niveau
meets
national,
specific
quand vous le faites, la
requirements. And at
certification,
national
c'est
level,
clair,
the
c'est une
certificate is
attestation
clear,
de
is
conformité,
just a
conformité à ce qui doit être fait. Et
attestation to what
la
has to be
certification,
done.
c'est de
But
2
the
à 3 ans. Et
certification
cela
here
est déterminé
is
au niveau national. Il y a des pays où
2
même
to
on pourra
3
vous dire
years
c'est une année pour mettre plus de
regarding national
contraintes et avoir
level.
plus un œil
And
sur ce qui est fait
you
dans
can
les
then
laboratoires.
see what we can then better follow what laboratories are doing by doing that this way.
Bon, au niveau de ma diapo, il y a quelque chose qui manque parce que dans la version, il y a normalement, j'avais fait un schéma sur la norme et sur les standards. Donc, pour être reconnu, on a ce qu'on appelle, quand on va dans la certification dans un pays, quand on va dans la certification dans un pays, la structure est amenée à mettre en place les normes par niveau de laboratoire. Et lorsque la structure arrive à mettre en place les normes par niveau de laboratoire, vous verrez qu'en même temps dans le pays, nous avons parlé d'infrastructure qualité, où vous avez en place ce qu'on appelle un organisme d'évaluation de la conformité qui doit démontrer sa compétence et son professionnalisme à réaliser l'activité.
Different tools that will enable us to check
à réaliser l'activité, ça fait que cet organisme peut, de manière volontaire, c'est ce que j'ai mis je suis une structure, j'ai fini de mettre
for example, I am a structure, I put in place the standards at national level. What do? I then call the structure that needs to assess me, and then you have
qui vont venir vous évaluer. Et à l'issue de cette évaluation,
evaluators that will come to your structure and that will declare that you are certified.
Maintenant, en même temps, cette même structure peut être sollicitée par le ministère de la Santé parce qu'on aurait appris que dans telle structure, ça ne va pas. On peut les solliciter pour aller vous évaluer sur la base de ces référentiels et ensuite pouvoir prendre des décisions idoines pour en tout cas se rassurer que les patients bénéficient des résultats les meilleurs. Et donc, lorsque on est conforme, cela débouche à l'attestation de compétences et conformité. Parce que nous sommes dans un niveau national, on peut combiner les deux parce que c'est difficile d'avoir un organisme pour la certification, un organisme pour, en ce moment,
and also for your accreditation.
Slide, please.
Next slide.
Et ensuite, maintenant, ça c'est juste pour vous donner
this is just to give
un bref
you
aperçu sur l'accréditation au niveau national. Il faut
at
noter que le point de
national
départ, c'est un laboratoire qui met en place un système
you
de
have a
management de la
laboratory
qualité
that
qui est
has
basé sur la norme ISO
place,
1589, parce que là, je parle d'accréditation internationale.
management
Et lorsqu'on a
system
fini de
based
mettre en
on
place ces
ISO
exigences, cette structure prend
189,
attache
and
avec un
then
organisme
this
d'accréditation. Et
will
notez bien qu'il est
contact
important
an accreditation organ to test them, so that you need to choose a body which is accredited with 17011, and then they will send auditors to
le rapport à l'organisme d'accréditation.
your
Au niveau de
laboratory.
l'organisme d'accréditation,
And
vous avez ce qu'on appelle
level
un
of
comité technique
accreditation, you
d'accréditation
also
qui va
have
évaluer le rapport qui a été
technical
transmis par les auditeurs.
accreditation
Et sur la
committee,
base de la
and
satisfaction
based
des
on the
exigences de la norme,
satisfaction
des
on
exigences de
how you
l'organisme
satisfied
d'accréditation,
regarding
ils
the
vont dire,
standards,
OK,
they
on
will
peut
say,
accréditer,
well,
et ils le
okay,
notifient à leur
we can
directeur qui le notifie également
give the
au niveau du
accreditation, and
laboratoire. Et
the
donc, je vous ai
director
résumé
of
ces
the
étapes
laboratory
ici en français.
will
Et
be
donc, quand l'organisme vous
contacted,
dit vous êtes accrédité, vous l'êtes
when
certainement pour
you
2 ans.
have accreditation,
pour 5
it will be
Et
for
maintenant,
2 to
notez que
5
cette
years. I have
accréditation,
here in
il y aura
French
des visites
mentioned
de
all
suivi.
the
Lors de ces
steps.
visites de suivi,
Certainly, you
on
will
peut
later
suspendre
receive
notre
this
accréditation. Mais
slide in
également,
English,
on peut retirer notre accréditation.
they
Par
can
exemple, en
also
Afrique du Sud,
remove
je crois, il y a
your
une étude qui parlait de
accreditation.
ça.
I believe
Les
that there was
retards
a study in
d'accréditation,
South
c'était
Africa that
entre
mentioned that.
0,6
I believe
et
that
3%.
it was
Mais
the
il faut toujours
accreditation
montrer
rate
patte blanche
between
pour renouveler son
0.6 to 3%. So yes, it can be refused
Et
definitely.
donc, ça, c'est juste un rappel pour vous
So
dire
this is
qu'une
just
fois
to
que
remind
vous
you
mettez
that
en place
once
votre système
you
de management de la
put
qualité,
in place
vous pouvez maintenant,
your
bien sûr,
management
faire appel à
system,
beaucoup
you can
d'organismes.
also
Et aujourd'hui, nous avons la
call
chance qu'en Afrique, beaucoup de pays ont été
organism to
couverts à cause, bien
accredit
sûr,
for
de la stratégie
do an audit for
d'organismes
your
d'accréditation
accreditation,
multi-économique qui
and
couvre plusieurs
it
pays.
will
Et donc,
cover,
sur ce, je
they
vous dis
cover
merci.
normally
Et
different
je-
countries, and I would like
Dr.
to
Thier,
thank
pour
you,
la poursuite de
and I would
la
call
présentation.
Dr.
Merci.
Thier to continue this presentation. Thank you very much.
Thank you, ladies and gentlemen, and thank you to the presenters. For those of you who are wondering, all the presentations will be made available to participants at the end of the workshop on a pen drive in both English and French. So we apologize for the technical issues that they have been in the first half of the program. We are going to take a few questions now. We're going to take 4 questions, please, on any of the presentations to any of the presenters, and then we're going to go for a tea break. When we come back, we will continue with this presentation. Okay, so please, if there are any questions, kindly just raise your hand, and then you can turn on your microphone, please. Any questions or comments, please? Okay, I don't see any hands up. So if in case you still have anything and you will maybe have the opportunity after tea just to have 5 minutes in the beginning, we'll also be looking online on the Zoom chat to see what questions are coming up that perhaps we can address after the tea break. So for now, please, ladies and gentlemen, through the doors on your right-hand side or to my right-hand side, there's tea available for you. And for those online, please, if you can just we'll have a short break and then we'll come back and continue this session in 20 minutes. Thank you. So for those who are joining us through the live stream, please know that please continue to put your questions and your queries in the chat box, and we will address them during the next Q&A. We are still collating those questions and comments. Just one which I saw very quickly, which you could probably address, was one of the participants asked from the online streamer that they were going to get certificates for the workshop. No, unfortunately, the stream, the live stream doesn't give you access to the certificates. It's a 5-day workshop. We're just live streaming the first day, but I assure you that there'll be lots of other opportunities for you to learn with ASLM through our academy and to be able to get qualifications and certificates for those programs. So to the participant who asked that question, I hope that adequately answers the question. So we're going to move on with a presentation which looks at QMS implementation in Africa in the past decade, lessons learned. And the next presenter is going to be Mr. Teferi Mekonnen. Teferi has been the SLIPTA lead with ASLM since its initiation. And so there's no better person to take us through what has happened with SLIPTA over the last 10 years and perhaps where we see SLIPTA going in the next 10 years. So Teferi, please.
Good morning, everyone. I'm very happy to see some of the ASLM certified SLIPTA auditors in the room. It's really amazing and very encouraging. So my talk would be on the SLIPTA program. It is the stepwise laboratory quality improvement process to address accreditation, which we have been using to transform the way of practice in our laboratory. And I'm very pleased also to announce that we have modified the logo, and this logo, the one projected, is a new modified logo. So at ASLM, we presume that this logo would help us to encourage and motivate countries and laboratories to accelerate the implementation of quality management system. We have observed that some of the countries and the laboratories are sitting and relaxing after we have been running to use the SLIPTA program to push our laboratories toward this and a better position. There is a kind of relaxation. So the change of the logo would help to catalyze the acceleration of quality management system implementation at the laboratory or at the country level. The SLIPTA is established at the program to structure and coordinate the implementation of quality management system in the resource-limited countries. This program is very, very critically important and supporting or pushing the implementation of quality management system. And it is designed based on the ISO 15189 standard. We have taken into consideration to accommodate all the technical and managerial requirement which is presented in this standard. And to a certain extent, we have tried to align those 12 quality system essentials presented by the CLSI QMS guideline, and it is incorporated into the SLIPTA program. So the SLIPTA program is developed with the checklist, and the checklist would be used to see the stepwise improvement of the laboratories in terms of QMS implementation. And in a stepwise manner, they are expected to fulfill or gradually fulfill all the requirement that is provided with the standard. And here, as you can see in this picture, there is a stepwise that would take us from 0 star all the way to 5 star. So when the laboratories start with the implementation, with the establishment and implementation of quality management system, mostly they would be at the 0 level, and with our support, we would try to push them to the next star level. So as they implement quality management system, they can be moving towards the next star level up until they become champions. They would be champion when they get to the star level, the last star level, which is 5 star. And at the ASLM, or even at the WHO, AFRO, and those collaborating institutions who came up with this program, they intend to support laboratories to move from the lower level to the higher star level. So this way we would build the quality of service in the medical laboratory program. The SLIPTA has a specific checklist, and it is very peculiar in its nature because it does have 3 parts. As you can see, there is the first part, second part, and the third part. And these are very, very critically important to capture all the information about those laboratories which would be enrolled into the program. And the nature, again, the layout of the checklist is presented in association with the 12 quality system essential, and we come up with the 12 section as displayed here, and there are a star level based on their attainable score. And the possible maximum score is 275, and we'll try to evaluate laboratories based on their performance. So the checklist would have additional advantage as a checklist when we visit in the laboratories. The first one is it would help us to determine if the laboratory is providing accurate and reliable results in the laboratory. And again, it can help us to determine if the laboratory is well managed or it is governed under the good laboratory practice. And also it can help us to identify the gap that need to be improved in the quality management system implementation process. And again, this audit report can be used as an input to develop the country-specific planning. It can help us to develop a plan, we can itemize those planning so that we can capture everything and put it in a plan. In terms of the implementation of SLIPTA, WHO Afro sent out this memo back in 2012. And the key message in this memo was to inform all those member states in Africa to be informed about the designation of ASLM to act as an independent implementer of the SLIPTA program. So ASLM became the secretary of the SLIPTA program. And when we started the implementation of the SLIPTA program, of course, we have observed as a kind of confusion out in the field, especially in the following 2 pointers. One, there is a kind of confusion at the management or at the top level or even in the field. There is a misuse between SLAMTA and SLIPTA. And they need to be clearly understood because the two are complementary to each other, but they are not replacing the other one. And again, when we go out to the field, people would take SLIPTA to replace accreditation, but it is not the intent of SLIPTA. SLIPTA is a program designed to be a certification program by a third party, and the third party would be ASLM, which is designated by WHO Afro to implement the program in the continent. Here, how does it work? Still, there are unclear information on this case, but it is clearly indicated that there is a governance structure defined to lead the program, and these stakeholders, which are indicated in different colors, would be responsible in certain activities. But the one which is indicated at the center of this governance structure is the ASLM, which is acting like a secretary for the SLIPTA program. And there are the Ministry of Health and the laboratories, and again, the independent advisory group, and the ASLM certified auditors, and the WHO Afro focal person. All these are the stakeholders for the implementation of the SLIPTA program. And these stakeholders would have a defined responsibilities as indicated in the guideline. So you can refer the guideline, but the countries would be highly responsible in terms of raising financial resource to support the program, and again designate a SLIPTA focal person or unit at the Ministry of Health who would link or oversee the SLIPTA implementation program in the country at the national level or going down to the laboratory level. And again, facilities would be also responsible in terms of implementing quality management system. They need to be committed to transform their way of practice by implementing quality management system. And this need to be focused targeted, planned, and implemented so that they can report or they can collaborate or communicate with the Ministry of Health in the country so that they can be recruited into this program. And then ASLM would go and audit this laboratory. And the auditors, we're not using consultant for the SLIPTA program, as most of you know that we are training our laboratory professionals in various countries to be ASLM trained and certified in the SLIPTA program. So these are our people who would be trained and again assigned to conduct the audit on behalf of ASLM. This is actually a win-win situation. And it is motivating our personnel who's been working in the implementation. Now, when they are trained as auditors, they would have additional knowledge and skill to audit in terms of compliance and in terms of competency of those laboratories. And again, we do have independent advisory group, or sometimes we call it as committee. These are the ones who would be responsible in making the star level determination. It is not the ASLM or the auditors who can make this star level determination right after the audit. The audit report, I would explain it in the coming slide, but these are responsible in terms of making the star level determination and resolving issues whenever we receive complaint from the field. And the SLIPTA Secretariat is definitely, it is ASLM, and ASLM is shouldering all the responsibilities in terms of mobilizing the program. So when we talk about the process, the SLIPTA implementation process, ASLM would have a strategy, and the strategy is first to train the laboratory professionals as auditor, and then assign auditors to conduct the audit, and then right after the audit, we will issue certificate of recognition, so that can motivate and encourage laboratories. And with this strategy, we do have a defined process in the pre-audit, the audit, and post-audit program. So for the application, we do have a criteria, the eligibility criteria, which is defined and presented in the guideline, or it is provided in the application form, and it would be communicated. But we are very serious in terms of picking one of the eligibility criteria, which is the level of the performance when it was done at the self-audit. During the self-audit, we would like to see those laboratories to be a minimum of 1-star level so that we can send our auditors. But if still they are in 0-star, it's not wise to send auditor from ASLM side. So whatever application we receive, we will review and make a decision in terms of to enroll those laboratories or recommend for some kind of improvement so that they can resubmit the application. But after the application, we will let the country or the SLIPTA focal person and discuss when we can arrange the audit program. So application can be sent to ASLM, and the self-audit can be done by the lab staff or the MOH designated personnel in the country. During the audit, yes, ASLM will select those certified auditors in the country, or it can be in the neighboring country. Those certified auditors would conduct the audit on behalf of ASLM, and we usually assign 2 auditors to conduct audit, and we will usually allocate 2 days per laboratory for the audit. And the main purpose of the audit is to address 2 issues at the same time. The first one is to identify the gap and at the same time to give them recommendation right on the site. So in this case, in the SLIPTA program, we are allowed to discuss, to give technical assistance while we are doing the audit, unlike the accreditation assessment, where we would not be allowed to give consultation or recommendation while we are assessing the laboratory. So this is the beauty. The next beauty of the SLIPTA program is having the debriefing, where ASLM can represent laboratories and advocate on behalf of the laboratories. We will convene the key message, the key gaps that need to be addressed, or the top management need to give attention Okay, so the debriefing is another beauty of the SLIPTA program, and we use the debriefing session to demystify the issue, the secret, and make it easy so that the top management would be ready for better commitment and resource allocation for further improvement. And ultimately, during the audit, of course, the laboratories are expected to agree and acknowledge on the audit findings. And in the case of the post-audit, as you can see on the cyclic picture, the auditors will submit the report to ASLM. ASLM would review and submit to the independent advisory committee. And then the independent advisory committee would review and make a star level determination. Then they would communicate with the ASLM management on the decision that they made on the star level. And then that would be used to issue certificate of recognition to those laboratories. Laboratories which would be at 0 star would not definitely get any certificate, but those who would be 1 star up to 5 star would get certificate from ASLM. This is the first ever certificate that has been printed by ASLM back in 2013. The certificate is a recognition that would be given to the lab. And it is a kind of witness to demonstrate that the lab is undergoing quality management system improvement program. And this certificate would be valid for 2 years. And again, it would be recognized beyond the territory. If we are going to audit, for instance, this laboratory was audited back in 2013 in Lesotho. It is a military hospital laboratory. And we issued 3 star for this laboratory. So when we give them recognition, the benefit of applying or enrolling your laboratory into the ASLM program is to get recognition beyond the territory, beyond the border. They will get recognition that they have attained this star level. Okay? So this is really very encouraging. What about after the post-audit? This is, I think, the bottleneck that we need to resolve. And I think the main objective of this meeting is to resolve this kind of bottleneck and move forward the way we used to implement in those days, in the 2012, 13, 14, and 15. So in the post-audit activities, laboratory staff and management will address those identified gaps. And again, virtual consultation is possible with the assigned auditors who conducted the audit, still can be communicated or reached out virtually so that they can give you further consultation and advice. And the MOH need to provide more support and guidance in terms of encouraging and motivation so that laboratories would not sit and relax, or we cannot see a break of the momentum. It should be accelerating and going on. So more commitment and resource allocation can be expected from the management, and again, preparation for the next round of SLIPTA audit. Or if they are well prepared and ready to go for accreditation, they can still go for accreditation with the recommendation that we can give them right after the audit. And again, what are the costs that would be incurred in the SLIPTA program? We have categorized this into 3 categories. The cost during the preparation, and again, during the audit and the post-audit categories. So at the preparation, we need to train people on various issues and help them to develop quality document and records, and then arrange the path of workflow or transform the modernization of our system in the lab. And then our laboratory need to encourage into the quality assurance program, in various quality assurance program. And again, the equipment is still critical part that we need to address at the preparation. But during the audit program, we usually have a cost for the application and the travel logistics for the auditors. And again, hosting centralized debriefing would incur also a limited resource so that we can have everybody in the country sitting together and discussing right after the audit program. But after the audit, yes, the laboratories are expected to make corrective action, and for this, they need to invest to correct or address those identified non-conformities. And the top management people need to be aware about this requirement so that they can allocate resource to support the laboratories. And training and certification. If our people in the lab would have been trained on quality management system at the basic requirement, then they need to be trained on the advanced requirement, like the root cause analysis, corrective and preventive action, method validation and verification, internal auditing, management review, and there are so many additional training that we need to facilitate and build the competency of our people, so that at the end of the day, it would help us to boost the quality of our laboratories. And again, we need to arrange a kind of technical assistance or mentorship program in the country or within the laboratory so that they can be supported to move in a higher speed to get to the next level. Quality assurance would remain equipment. So whenever we talk about quality management system, I would like to tell you 3 critical words. The very first one is implementation. So we need to implement quality management system, which means that we need to develop quality document, like the quality manual, the SOPs, and then we have to move to the next one, which is implementation. The implementation need to be based on the system that we established in the laboratory. So this is the second. And the third one would be, how do we maintain what we established and try to implement in the laboratory? Because we see some kind of gap on this third issue. How do we continuously improve our quality management system in the laboratory? There are people who think that implementing quality management system would be only for one time. No, it is an eternal process. As long as the door of the lab is open for service, we need to train and implement our people. We need to implement quality management system in a continuous way. We need to, even those accredited laboratories need to improve their quality management system. So it is a continuous, and I would like to the big bosses to consider this issue. With this, I will wind up my presentation, and if you have a question or comment, we would entertain it when we're up for the question and answer. But otherwise, thank you very much for your keen attention.
So thank you, Dr. Teferi, and also Dr. Samba for giving this overview of what we have done in the past decades with regard to quality management system implementation on the continent. As you saw, there have been a lot of efforts to improve quality of lab services at individual laboratories. We have seen these tools, the SLIPTA, the SLIPTA, and the WHO LQSI tool. And in addition to this, there are many more tools. Many organizations have implemented funding and have put efforts in place to strengthen the quality of individual laboratory facilities. On the other hand, if you look at what we saw in the presentations that we have seen up to now, you see that only a small percentage of laboratories are accredited. We have seen that only 6% of laboratories in Africa have achieved accreditation. 668 laboratories from 26 countries, of which 45 are from South Africa, 0.6% from Central Africa, and 5.7% from West Africa. And also that accreditation represents only 1.1% of the laboratories in the public sector. So these 6% of the laboratories being accredited also means that 94% of the laboratories cannot assure quality of their services as witnessed by accreditation, as witnessed by having implemented a quality management system based on international standards. And of course, this impacts the quality of diagnostic services and thus clinical and public health outcomes. So we have to ask ourselves the question, why doesn't quality management systems implementation expand faster? Well, one, and I think the main reason for this, is that ISO accreditation requires that all requirements are always in place. However, some requirements cannot be arranged by individual laboratories. Because laboratories are part of a laboratory network in the country, that is supported by a laboratory system. Let's see if I can find a pointer here. So here we see the network, this triangle here with all the different tiers of the laboratory network or of the health system in general. And then we have the laboratory system that is supposed to support the laboratories in the laboratory network. All laboratory system elements need to be in place and fully functional for a laboratory to implement a quality management system and to provide quality laboratory services. But many of these elements have to be arranged at national level. For example, the human resources here. For accreditation, a laboratory must have a continuous education program. But training opportunities are not set at the level of the individual laboratory. These need to be set at the national level. Equipment. Continuous maintenance and calibration of equipment is a requirement for accreditation. But again, equipment maintenance capacity needs to be available in the country, cannot be arranged by an individual laboratory. In the public sector, laboratories are often dependent on procurement and supply chain management systems. And processes as part of these systems may be long and tedious, even leading to stockouts. And that is not acceptable under ISO. So you see, in order to comply with the requirements of a standard, in order to have a functioning quality management system and to maintain the quality management system, a laboratory is dependent also on external factors at laboratory system level. But many of these activities, again, have to be regulated at a national level. And there is even a separate system element, specific system element for this, the legal and regulatory framework. Also, the chain is as strong as the weakest link. That also applies to the laboratory system. If one of the elements of the laboratory system is not functioning correctly, other elements will also be affected. If the procurement and supply chain management system doesn't allow the procurement of equipment that is needed by a laboratory, then of course the equipment element will also be affected. So what is the logical next step, keeping this in mind? Well, to not only pay attention to implementation of quality management systems at individual laboratory facility level, but also, in addition, arrange quality management at the network and laboratory system level. And that can be done by building a national laboratory quality infrastructure, which consists of the following elements. A national accreditation body that can accredit laboratories based on international standards. Establishing national laboratory quality standards, preferably tiered or staged standards, as already was said at the Lyon conference that Dr. Ondoa mentioned this morning. Having standards that build on each other so that laboratories can gradually expand their quality management system, implement their quality management system. Also putting in place a national laboratory licensing system that licenses laboratories, including their compliance to these national laboratory quality standards. Addressing the workforce, ensuring that the pre-service education is up to standards, and also in-service education, continuous education is possible. Establishing national external quality assessment programs, EQA programs, for all the essential diagnostic tests. And calibration of equipment, of course, making sure that there is enough in-country maintenance and calibration capacity by a national metrology institute and also in the private sector, for example. That also complies with quality standards, so that you know that if I send my piece of equipment to this organization, it will come back fully calibrated and the traceability will be all right. Establishing a monitoring and evaluation framework is also part of the quality infrastructure, and maybe also a tiered system of supervision where laboratories in higher tiers of the laboratory network assist and supervise laboratories in lower tiers with, among others, the implementation of the national standards or international standards of implementation of a quality management system. Now, fortunately, There is now a guidance available for this, and that is this NLQF guidance, the guidance for establishing a national laboratory quality framework, which will be rolled out in countries under the mandate of Africa CDC and other regional stakeholders. So the NLQF guidance is a continental initiative that enables policymakers to solidify QMS efforts into national policy and planning, to create a countrywide approach to advance QMS implementation at all levels of the health system, at all levels of the laboratory network, not only the national tier, the national laboratories, the central laboratories, but also the laboratories in lower tiers of the network should be able to implement a quality management system that is needed and tailored to their level of services. Just to emphasize, to prevent any confusion, the NLQF guidance will not replace any of the tools that you have seen this morning. It will not replace the SLIPTA, LQSI tool, or any of the other tools you see here. Instead, it is complementary. These tools assist laboratories, individual laboratories, facilities with implementation of a quality management system. The NLQF guidance addresses the laboratory network and system to support those laboratories with the implementation and maintenance of a quality management system. So how are we going to familiarize you with this guidance? Let's briefly go through the workshop program. It's a 5 days workshop, and it is really a workshop. There will be plenary sessions, especially today. We have quite a lot of plenary sessions, presentations, but we will also do a lot of country teamwork, a lot of exercises with the NLQF guidance to become familiar with it, but also to directly start using it to strengthen the laboratory network and system in your country. So we'll have country teamwork in breakout rooms with discussions among countries and then presentations by country teams. There will be brief lectures, especially from tomorrow up to the end of the workshop, and plenary discussions. So quickly through the program, we are now at number 3, session number 3. After me, I will give the floor to Beatrice van der Puye, who will give more information on external quality assessment, one of those critical elements for quality. And then my colleague Linda will present a bit more information, information that you need on a laboratory network and system strengthening. And we'll have presentations from 2 countries, South Africa and Cameroon, with perspectives of implementing a quality management system. And then this afternoon we'll have country teamwork, the first session of the country teamwork. Tomorrow we will focus in more detail on the NLQF guidance. We will go especially through this critical part, the most elementary part of the NLQF guidance, which is a blueprint, national laboratory quality policy and strategic plan. And we will continue working with that in the country teamwork that follows. On day 3, again, we will focus in more detail on this NLQF guidance, and the rest of the day we will do country teamwork again to really start working with the guidance. On day 4, we shift our focus to planning, because there we are already nearing the end of the workshop, so it's important to think about how are we going to proceed with our efforts that we started during the workshop to make sure that at home we can strengthen our laboratory networks and systems in our home countries. And you will be asked to present all the work that you've done during this workshop at the end of Thursday and on Friday up to the tea break in the afternoon. We will get the country presentations. The country teams will present what they have done during this workshop, after which we will discuss the way forward after this workshop and close the workshop. Just some workshop etiquettes. Please be on time. Obviously, respect each other. Please ask questions, but raise your hand if you have a question. Don't use your mobile phone in the room. And also, please don't use your laptops outside the assignments. Only use your laptops for the assignments. And if you're sitting here, please close your laptops. So the key messages, strengthening of the laboratory network and system is essential to continue and advance quality management system implementation. The NLQF guidance is a continental initiative to support countries to improve laboratory quality in an efficient, pragmatic, and country-owned way. And the approach is compatible with existing programs. It enables policymakers to solidify QMS efforts into national policy and planning, to create a country-wide approach to advance QMS implementation at all levels of the health system. And the rollout in countries will be under the mandate of Africa CDC and other regional stakeholders. And this is an important message that I want to close with. National efforts to advance QMS implementation will strengthen diagnostic capacity, so universal health coverage, but also outbreak preparedness, IHR. You really work on all areas. Not sure whether we have any questions now or later. Questions now? All right. Do you have any questions so far?
Thank you for nice presentations. My question is going to SLIPTA or SLIPTA. So when I was following the presentations, I heard mentioning, I saw you were mentioning the ISO that is used for the medical lab. So now my question is, can the SLIPTA be also compatible if I'm using the ISO 17025 of that is using in the animal lab? So I didn't hear or see being mentioned.
Would you like to address this question, Teferi, or do you want me to?
Yes.
Yes.
Yeah. Basically, when we start the implementation of SLIPTA at the ASLM, we mainly focused on the human sector. But as we go along, we try to use the 17025 standard and try to support the veterinary laboratories. So both the animal and the human sector can be addressed using the SLIPTA program. And a good example is what we have been doing in Ethiopia, in Nigeria, and again in Burkina Faso can be mentioned as example. But again, at ASLM, there is one program that is trying to implement quality management system and support the veterinary laboratories. I think Beatrice is the one who is leading that program, and she can chip in and explain more about that. Thank you.
So yes, thank you, Teferi. So under EQuAFRICA, those of you who are here from the animal health and veterinary labs will know that we have been providing QMS training under the requirements of 17025, and we had a whole program of that. But as part of that program, we also started working on having a 17025 version of the SLIPTA checklist. And so that is still in progress, and we hope to be able to finalize that and provide that in the coming months. Just to say that in terms of using the SLIPTA checklist, a lot of the requirements of the QMS cut across, right? So they do cut across. However, I would say that for 15189, they are very specific and strict requirements because you're dealing with human health samples. And so to use the same checklist in the animal health environment can be very challenging. So as much as possible, unfortunately, you have to just go back to the 17025 standard, but the checklist is in progress. So you will have an animal health version of the SLIPTA checklist, or a 17025 version of the SLIPTA checklist.
Thank you so much, our presenters, for all the presentations. They are quite clear. I have just a simple question for Teferi. You mentioned about the three critical areas in QMS, and one of those is implementation, and the other one is about sustainability as to how do we maintain the activities of QMS. But I missed on the third one, so I just wondered if I could come again on that one. Thank you.
Thank you, Teresa, for this question. Yes, I said in the case of quality management system, we do have three critical terminologies that would help us to lead the program. The first one is the establishment. So we need to establish our system based on the preset standard. It can be internationally developed or nationally developed standard. That would help us to develop our quality management system. So we need to develop documents like the quality manual, SOPs, and the like. And the second phase is the implementation. Implementation should be based on what we have established in our setup or in our laboratory. So when you implement, you need to train your people and make them aware of what you have established in the system, and then they have to implement. Okay. The last one is the maintenance part, which is very critical or a bit difficult for most of the lab or the Ministry of Health people to support the laboratories to address this one. You know, to maintain what you have established and maintain, you need to continually improve what you have established and then implemented. It should be continuously improved so that you can maintain it, which otherwise, if you cannot continuously improve it, it's like preservation. You know, you would have something and put it on the shelf, like quality manual would be developed, SOP can be developed and kept on the shelf. That is like a preservation. It is not improving. But what we are talking is, let's make it more lively so that we can continuously improve our established system and the way of implementation so that we can take it to the next level. I hope this would clarify.
So thank you very much. I can see that there are more hands up for questions. We want to move forward with the program, but please be assured that we will come back to your questions. So just put them down on a note, a piece of paper. At the end of this next set of presentations, we will have a longer question and answer session, because after that we're going to lunch, so we can have some more discussions. Just Teferi, just a quick comment, I think, from Dr. Fili from Nigeria Online, and he mentioned that there needs to be clarity between the coordination of SLAMTA and the coordination of SLIPTA in countries, and that it would be good for us to start to update the list of SLIPTA coordinators in countries so that we can make the clear distinction between the two. So that was just a comment. Okay. So the next presentation is going to be from me. And I'm going to be my job here this afternoon really is to talk about the role of QMS in strengthening EQA program coverage, uptake, and participation in Africa. Okay, so Ellie, kindly change the slides for me. They're both in English. It's okay. I think you have to move. So if there's any, please, for our Francophone colleagues, if there are any presentations that you currently don't have in French, please be assured that they will be provided to you by the end of the week in French as well. And it will also, for our online participants who are asking, all the presentations and resources will be provided online at our resources page, and the link will be shared with you after, for those who registered and sent their emails. So please go back one, Ellie. So as I said, my job this afternoon is to talk about the role of QMS in strengthening EQA program coverage, uptake, and participation in Africa. Next slide. So what are we here? Why are we here? We're here under EQuAFRICA. And what is EQuAFRICA all about? So EQuAFRICA is the external assessment, regional external assessment grant for Africa, which is funded through the Fleming Fund. Thank you. And one of the main objectives of this grant, and the whole Fleming Fund grant is focused on AMR and on strengthening systems for AMR surveillance across Africa. And when we talk about systems for AMR surveillance, the lab is a critical part of that, right? The lab is the point at which that data that is fed into surveillance systems is generated. So ensuring the quality of the data that comes from lab is very important. So one of the key objectives of the Regional External Assurance Grant for Africa is strengthening EQA for pathogen identification and antimicrobial susceptibility testing in Africa. And you can see on the right-hand side the 14 countries represented here that we're working with. But why EQA? Why is it called the External Quality Assessment Grant for Africa? And why are we focusing on EQA? So I know that a lot of you are very seasoned QMS professionals, but for those of us who may not be, and we just want to take a little summary of what EQA is. So why focus on EQA? EQA is really an objective external assessment of a laboratory's competency. Basically, participation in EQA is external validation that you in your lab know what you're doing and can do what you need to do for the test services you provide to the expected quality standards. So that depends on what standards you are working to. But there are universal standards which we all work to, good laboratory practice, etc., standards of quality. ISO has been mentioned, continuing to other workshops, so we'll talk about that. EQA ensures tests are performed accurately and results are comparable and reproducible. And it also helps us to detect errors and weaknesses in our system. One of the key aspects of having quality management is to make sure that we're continually improving, because we know that there is always areas for improvement. And so EQA also helps us to be able to look at our systems and processes and say, where are the errors? Where do we have errors, or where do we have weaknesses in our system that we need to address and we need to strengthen? And EQA can be done in various different formats. You have peer review, proficiency testing, on-site evaluation, retesting, and rechecking. And I won't go into detail about each of these. I'm sure a lot of you are very familiar with some of these, but what we discuss the most and what we're talking about here mostly is proficiency testing, where basically a sample is sent to you by an external EQA provider. You test that sample, you send back the result is assessed against the expected result, and you are given a performance evaluation, a performance report, which you can then look at to identify if you have any weaknesses and gaps in your system. So EQA, when it comes to ISO, is an absolute requirement. So if you are going forward for accreditation, and those of you who have been accredited will know that if you are applying for accreditation and you meet 98% of the requirements, but you do not participate in EQA or perform internal quality control for the test that you do, you will not get accredited. That's right, correct, patient. You will not get accredited. So that is the importance that EQA is held. So ISO 15189 requires that every lab participates in EQA programs if you want to be accredited. And not only should you be participating, but your performance is also evaluated. You should be passing. So EQA then is very important. So when it comes to EQuAFRICA, looking at EQA then, or talking about EQA in terms of AMR testing then becomes relevant. And when we were looking at our strategy in terms of how do we strengthen EQA participation, we came up with a three-step approach. So the first was to, number one, ensure coverage of EQA for AMR under One Health. Second strategy was to increase EQA program establishment and uptake, and to improve the performance of participants. And this strategy was based on studies that we did on EQA coverage, uptake, and generally coverage and uptake in Africa, let me say. And I'll talk about that later on in the presentation. But just remember these three strategies. Ensure coverage of EQA for AMR under One Health, so that means covering not just human health, but animal health, and in some cases, environmental health. Increase EQA program establishment and uptake, and improve performance of participants. So what have we done to date in terms of these three strategies? The first thing we did, and was mentioned in Luna's presentation, is that we have established an EQA program for AMR, which currently covers the 14 countries, but that we hope, moving forward, will be expanded to more countries within the region. So, and this program is instituted by Amref, NICD, and IPD. So IPD, Institut Pasteur Senegal, it covers the West and Central African region, and Amref and NICD cover the Southern African region. And just to say that, so those Anglophone countries, you will be part of the NICD's program, just for standardization purposes. But currently we have 156 labs across these 14 countries, reference labs and sentinel sites. So you can see that already the participation in just 14 countries is very high. And we've completed our third cycle currently of the EQA program, and we're looking forward to the next cycle of the EQA program. So that's one thing that we've done. We're also supporting countries by building their capacity to establish in-country EQA programs through training. So a few of you here would have participated in our trainings, which were facilitated by CLSI on EQA program establishment. So we went through the standards 17043, and we talked about the basic requirements for EQA program establishment. So that's another thing we're doing, building capacity. So then when it comes to strengthening EQA, we've been able to increase the coverage of laboratories participating in EQA for AMR at least. And we've also been able to start building capacities in countries for countries to be able to establish their own EQA programs, because we know that it's not, in terms of resources and capacity, we can't have every lab in every country participating in regional or international programs. So having in-country programs is going to be critical to ensure coverage throughout the network. So where does QMS come in? And why are we talking a lot about QMS when we are really focusing on EQA? But that's because for EQA to be effective, participation must be within a QMS. It must be, QMS must form the foundation of your participation in EQA. That is why EQA is considered to be important. EQA is not considered to be important on its own as a program, but within the context of quality management systems, because it's a way of assessing the quality and competency of that process. So participating in EQA alone doesn't say anything, to be honest, it doesn't. And a lot of the time, if you look at labs that are participating in EQA without implementing QMS, you find that the performance is very low, because EQA covers the entirety of your laboratory systems. So for us, QMS then has to become an integral part of that process of strengthening EQA uptake and participation in Africa. So again, coming to EQA or assessment and its role, because EQA is considered an assessment program, right? So let's think about the QMS, and I'm sure a lot of you are familiar with this diagram from CLSI, where we talk about the 12 quality system essentials, which form the foundation of establishment of QMS. And as you can see, EQA is clearly identified there under QMS. But these are all interlinked. The quote is actually a series of interlinked and coordinated activities that form the foundation for the establishment of a QMS. Interlinked. It doesn't say that individually they can help you to do that. So all of these working together then help you to establish your quality management system. So when you come to implementing your QMS, you have your path of workflow from the pre-analytical to the post-analytical, and you have your 12 quality system essentials that go into establishing that QMS. An assessment, again, is there, and what we are trying to do then is to meet the requirements of the standard in our implementation. And you can see beneath that it says, international and national regulatory and accreditation requirements. So we are putting in place that system so we can meet either our national, our regional, or international requirements for quality management. So coming back to the landscape analysis that I mentioned that we did at the beginning, and why, again, we thought that really the emphasis cannot be on EQA alone, but must be part of QMS, was a landscape analysis that we did at the beginning of this project to look at the EQA coverage, uptake, and participation in Africa. And the findings were extensive. We looked at what are the incentives and what are the barriers to participation. And one of the key things that came up was the appreciation of EQA as a program. What does EQA bring to the lab within the context of just on its own or within the context of QMS? So if you think about EQA and EQA participation, a lot of the time when you're asked to participate in EQA, we look at certain factors in the lab first. We say, what is this? How much is it going to cost? Is our next question. And when you look at our labs and our settings and the challenges that we have, very often when it comes to finding the resources to participate in something that we think is expensive and is not bringing us value, we focus on what we think is going to get us test results coming up. So if you don't appreciate the value of the QMS and the EQA within that QMS, then participation or uptake of EQA is going to remain low because you just see it as an additional unnecessary cost to the lab. So in the realization, we realized that, well, the first thing here, and as I said, this was one of the findings, but they all kind of led to the same conclusion, is resources, understanding of EQA. And so you realize that, well, the key thing here is that foundation, is for people to have that foundation of QMS, to understand the value then that EQA brings to the lab. So at country level, when we looked at the analysis, some of the things that we found was there was a lack of national systems for implementation of laboratory quality management systems at all levels of the laboratory network. So no mandate or support for LQMS implementation or EQA participation. A lot of you, raise your hand if your lab is supported by partners to participate in EQA. Yeah, a lot, yes? Most of us will say so. Linda mentioned something which I found very interesting. She said that when she was looking at the policies that you sent in, the pre-workshop homework you had to do, one of the questions asked, what are the strengths of your system? And most of you answered, partner support. Partner support. But it's true, right? That is, we rely heavily on partners to fund our systems, and similarly with EQA. So when the partners are coming in, what do? Nationally, with low resources and competing priorities, we step back and let them take over, right? Then also no quality infrastructure to support or guide QMS implementation. What is your plan? How are you going to do it? How are you going to put it through the tier? And no established standards for laboratory quality. So then coming back to this three-step strategy, I want to take you to step 3, improve performance of participants. And here we said we're going to implement EQA within the larger perspective of sustainable country-owned quality assurance programs through the strengthening or establishment of QMS. So now we are going to look at it holistically. To strengthen EQA, you must strengthen QMS. And that brings us to why we're here today. I think all the background information has been given about the National Quality Framework by Chaired, and more information will be given by Linda later, so I'm not going to dwell on that. But that is essentially what has brought us to the development of this guideline and to the reason why we're all at this workshop today. What we realized is that in country, QMS implementation happens, but it happens either through partner programs or it happens in silos where labs who are committed towards quality take the step. However, we do not have that national-led program that we need. The programs that will ensure that from the national level to a testing site, there is some level of quality at every point. That can ensure sustainability into the future. Somebody on the chat, one of the participants mentioned, he says, the deterioration or the decline, when Pascal did her presentation and she showed, the SLIPTA audits after 24 months, 48 months, 72 months, the decline, he says, this is something that we need to look at and ask ourselves why. And the why is simply because we don't own these programs. We don't own them. So when the partner withdraws, what happens? Everything shuts down. And so with the NLQF, what we're saying is that we want to see now quality implemented at the national level, at a systems and network level, where you can define your quality standards throughout the tiered network. Another comment on the chat was that accreditation should not be our only end point. We must be looking for quality at all levels, and we must be able to establish some standards for us to do so. And so with the NLQF, that is what we hope to achieve. So with that, I would like to say thank you very much to our partners, I think is the UK Security Agency now, IPD, NICD, Africa CDC, Amref, and DTU. Thank you very much. The next presentation is going to be given by Linda, and the presentation starts the importance of the laboratory network and system to advance QMS.
Okay, thank you. We're waiting for the French version to be on the screen as well, because there is a French version. I hear a big echo here. I'm not sure what's happening. There's no echo there? Okay, then I'll be okay. Okay, thank you very much. It's a pleasure to be here. Pleasure to finally see everybody face to face again after a couple of years of Zoom meetings and whatnot. What I would like to discuss with you today is the importance of the laboratory network and the system to advance QMS. And this actually fits in very nicely with this national approach. We're not talking individual laboratories. We are talking networks and systems, and I would like you to explain what it is and what the difference is between a network and a system, because it's often used interchangeably, but it's two different entities. So these are actually, there's a bit of a delay on the screen. Okay, so these are what I would like you to kind of learn today in this session. Okay, what is a network? Why is it important? What are different structures? What's the difference between a laboratory network and a system? What are the different system elements? And also, how do they relate to each other and how do they relate to quality management? So first of all, let's start with laboratory network. Why is it important? First of all, let's look at the Freetown Declaration, which says that integrated, tiered laboratory networks and surveillance systems are the cornerstone of effective healthcare and essential to robust detection and early response to public health threats. So what we see here is clinical care, patient care. Also we see public health and global health. They're all here, and laboratories, we in essence in the room, are important for that. And also the network and surveillance systems that are the basis for it. If we look at the Sustainable Development Goals, also 2015, it actually says ensuring that all people have access to needed health services of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. This actually means that also people living in remote areas somehow should have access to laboratory testing. That can be either in place at the location where they are, but also through a network approach, for example, through sample referral, all the way up to the national level. You don't want complete patients to travel on a bus. I mean, you prefer that a little tube of blood is traveling on the bus. And if we want to move towards universal health coverage, it is important that we strengthen the health systems, including laboratory systems and networks in all countries, so that we can ensure that everybody all over the world has access to good health care. Then we have the international health regulations, which you probably all are signatories to, all your countries. It's a binding instrument of the international law. It was signed by 196 countries. Most of these countries did so more than 15 years ago. And actually there are three elements to it, which is prevent, detect and response. And of course for detect, we as laboratories are crucial. Laboratory services should be available to test for priority health threats. Remember, this is about international health. This is not about patient care. So what is a laboratory network? That's the next question. It is, if you kind of use a definition, a collaborative group of health laboratories within a country. It includes health laboratories from different sectors, ideally. I have to say, the public laboratories are there, but also, if you do it well, the private for-profit and the private not-for-profit, faith-based, they call it in certain countries, laboratories. And if you really want to do it up to scratch, it should also be under a One Health approach. Normally speaking, it is organized in 3 to 5 tiered structures of testing facilities. And I'm showing you here the most complicated version, where you actually have national, regional, district, health center, and even community testing, which is often outside real laboratories. It's more like point of care testing. And the beauty is that it operates under common principles and procedures with tier-specific roles, responsibilities, and functions. So you don't have to do everything everywhere, but you can decide, okay, this is what we do at a certain tier. If we cannot do it there, or we don't have the capacity to do it there, actually we have a system in place that we can move samples up, or we can use more complicated forms of testing higher up in the network. Well, here is some of the things that actually show the interconnectedness of laboratories in a network, because of course specimens often they go up in the network. Data connectivity is something which can go up, but it can also go down. If you have a sample, if you're a health center, you send your sample to the regional level, you would like to have the result back. So you need to have some kind of a data connectivity to make sure that the result comes back so that your doctor or your health worker can start acting on it. But also, many of the lower level labs actually send monthly reports on what they see. Because most of the patients are seen at the lowest levels. Remember, 90% of the people are seen at the community level or the health center level. And most of the samples never reach the national level because it's not necessary. Also, we have the external quality assessment. Well, Beatrice already talked about that. The proficiency testing, the blinded rechecking, the supervision visits. And then we have the mentoring, which can go from the labs from the higher tier to a lower tier. But I'm a firm believer myself that I think it's also possible to do horizontal mentoring. If you have a very good district lab, there's no reason that that district lab cannot mentor another district lab which is close by but which is weaker. So horizontal mentor is something which is still in its infancy, but I think it is something which is possible. And then of course we have the training, we have the supply chain management, which often goes very staged all the way from up, all the way to down. I think there's also a lot to gain there actually. There are a lot of initiatives which we can start working on, but let's concentrate on quality management for the time being. Also, what we see is that, this is an example, if you look at the testing packages, you actually see that the lower you get in the network, the more decreased the specialization of the lab cadres. So they're more and more generalists. They maybe do only a few tests, but if they do microscopy, they can do TB microscopy, they can do malaria microscopy, they can do parasite checking in stool, everything. Whereas if you go up, you actually see that people get more and more specialized. You have the gene expert in essence for one disease, working full-time on that one disease on the gene expert machine. And you also see, on the other hand, that you have an increasing test complexity. The higher you get, the more complex the tests become. I mean, we start at community level, we start very simply with point of care tests. There's maybe some microscopy and some basic chemistry, which is added at the health center level. Then at the district level, there's microbiology, culture, in addition to all the tests which are there at the lower levels, of course. At the regional level, you may have AST, and then at the national level, you have the complete national testing portfolio. And the nice thing, what we saw with COVID, I mean, we've all been hit hard by COVID, but I think for the laboratories, it provides a tremendous opportunity. Because we saw that something like PCR was considered, it's a really complicated test, which we can only do at national level. And then the COVID actually forced us to think how we can move it down in the network, because you cannot do everything only at one national lab, especially not with the numbers of tests that you had to do at in certain countries. And I was discussing, I think, with Wati Passo from Malawi. I said, nobody knew what PCR was. And now you hear people on the television talking about RT values during the Olympics. And that is the shift which has been made. We've really been mainstreamed as laboratory services. So when you formalize your collaboration between laboratories in the form of a laboratory network, what do you get? What are the advantages? You get increased availability and access to diagnostics at the appropriate level. You have improved population coverage. You can pool your resources better, which means that you can do more for the same amount of money. You have a cost-effective utilization and delivery of diagnostic services, and you have mutual reinforcement of clinical care and the public health functions. Because at the national level they are often separated, but the lower you get into the network, the more they become combined, more or less. And ultimately, this should lead to a better health outcome for the people living in the country. That's what we are working towards, isn't it? So, what is the structure of of the network? First of all, you have to make sure it is in line with the political system. If you have a centralized system, then in your country you will have one laboratory network. But if in certain countries, I remember a long time ago when I was in Nigeria, I'm not sure whether this is still the case, but they had a devolved health system, which means that you may want to have a pyramid in each of the states, because that is easier, because everything is arranged at state level. Maybe it's not the case anymore in Nigeria, but there's certainly other countries where I've worked where this is still the case. And then the only level that is shared by everybody is the national level. But it is important that the structure of the network follows the political system, because that it makes it much easier for all your political discussions. Also, it has to be in line with the healthcare structure. So if your healthcare structure has 5 different kind of layers, 5 different tiers, make sure that your laboratory network is the same. If you have 3 tiers in the healthcare structure and you have 5 different tiers in the laboratory network, it becomes very, very complicated to decide who does what, where, and how do we do that with the samples and everything. So make sure that these things are in line with each other. And as I already said, a laboratory network should ideally include different, well, it's called here sectors, maybe it's better to say like different types of laboratories, the public laboratories, but also the private for-profit and the private not-for-profit laboratories. Sometimes the private for-profit laboratories can do things which you cannot do in the public sector. And maybe you can set up some kind of a memorandum of understanding that they help you with certain diseases which may be big health threats. Or alternatively, actually also you want the data from these laboratories to make sure that you know what the prevalence of a certain disease is in your country. So it is important to include the private laboratories as well. I mean, private not-for-profit, often faith-based laboratories, they are often already included in the network, but it's also important to include as much as possible the private laboratories. Maybe not totally, but certainly for certain functions. And if you really want to do it well, you should also take a One Health approach towards your laboratory network. That's the kind of the next step, the next challenge, I think. So what is a laboratory system as opposed to a laboratory network? Well, when you have a laboratory network, you actually have to have a lot of stuff in place in order to be able to perform your tests at all levels of the laboratory network. I mean, you can immediately think about trained staff and you can immediately think about supplies, but there are many other things. And they together form the laboratory system. And the laboratory system, I put it here as a kind of protective layer around the laboratory network, makes sure that your laboratory network can do all its functions, can continuously function. And there are many different system elements, but you can roughly kind of organize them into organizational ones, where we talk about the legal and regulatory framework, the organization and the partnerships. Then there is the inputs, so finance, money makes the world go round, they always say, the human resources, the infrastructure, the equipment, and the supply chain. You need all of these in order to be able to have a functional laboratory, but especially also a functional network. And then there's what's called the support elements, and that is where quality comes in, biosafety and waste management, and information systems. The point is with system elements that they are very interconnected. If we talk about quality, we're talking about infrastructure. We're talking about equipment maintenance. We're talking about trained staff. So you see that all these other elements are also very important. And the same for biosafety and waste management. I mean, your infrastructure, laboratories, it's very important that these are okay, because otherwise you can never have a proper biosafety and waste management system. So system elements are very interconnected. And here you see everything in one slide. Well, when we talk about quality, and I think this was already mentioned quite a few times, you need to have a national quality infrastructure in place, which means a national laboratory quality policy and/or strategic plan, national laboratory quality standards, a quality management system implementation, the licensing of the laboratories, the accreditation of laboratories, an EQA system, which I think Beatrice very forcefully really convinced us that we need to have EQA in place, and metrology and calibration. And then we also have the guiding principles. What do we want to achieve? We want to achieve optimal coverage. We want to achieve optimal accessibility for the patients, for the people in the country. Aren't always patients. We want to have a system which is sustainable and ideally not partner dependent. So that was also something which we already discussed. And it should be as cost effective as possible. We have very limited resources in many countries. It means it has to be done as cost effective as possible so that you can make most of your money. So the laboratory system supports the laboratory network, and system elements are complementary or complementary, I never know, it's one of the two. Well, you understand what I mean. They can be overlapping and they can be mutually reinforcing. And that is in particular true for quality. So the key messages: laboratory networks operate under common principles and procedures with tier-specific roles, responsibilities and functions. A well-designed functional laboratory network increases population coverage, availability and accessibility to diagnostics, cost-effective utilization and delivery of diagnostic services, and surveillance capacity. A laboratory network should be designed in line with the political and healthcare system, and the laboratory network is focused on structure and organization, whereas the laboratory system supports the network. So the laboratory system supports the network. Laboratory system elements include organizational input and support elements, and these can be complementary, overlapping, and mutual reinforcing. And guiding principles in the laboratory system and laboratory network are access, coverage, cost effectiveness, and sustainability. So I'm not sure whether we take questions now or whether you want to wait until after. Okay, thank you all very much.
When it comes to talking about implementing QMS from a systems and networks approach, there are very few countries who have been able to do this successfully. And that was reflected in the data again that Dr. Ndoa showed in her presentation. And one of those countries, as you saw, is South Africa. And so to give us a bit of encouragement and to let us know that this is possible, we would like to invite the very capable quality manager of NHLS, Patience Dabula, to give a presentation on what South Africa did, how they were able to achieve this. Because those of you who know the story will know that the incredible things she has achieved in 5 years at NHLS, including getting over 100 labs accredited in the public health system, right? Not the private system. Previously, when we used to talk about numbers in terms of accreditation in South Africa, it was in the private health sector. And now we're seeing the same gains made in the public health sector. So Patience, please tell us the story. Thank you.
Thank you very much, Beatrice, and thanks everyone for an opportunity to come here and share what we are doing. I thought because I'll start the presentation with what's happening in South Africa at a glance, since the participants are from 14 other countries, and we're here just to share healthcare in our country, standards and accreditation, looking at licensing, the National Health Laboratory Services, and how we manage the quality assurance programs in the NHLS. Just as an probably icebreaker, I'd say South Africa at a glance. The size is 1.2 million square kilometers, and the population, fortunately we had the latest census last year, is estimated at 60 million South Africans at this stage. Most of the population, anyway, 51% is female, and 80% of the population is Black. Life expectancy is about 59 years if you're male, and 65 years if you're female. And I thought, I'm not going to ask to raise your hands to say, are you at 59 or 64? So that we know what happens. So we have 9 provinces, and in the provinces we are now in Gauteng, which is here, the small one in the middle. It's represented here, and we are in Johannesburg, which is red when you look at here. We have 11 official languages, and English is what we use to trade, business, and official business in the country. Unemployment rate, unfortunately, by the year now, January this year, was at 36%, and the currency is in rands at about 15.5 US dollars at any time. As far as healthcare is concerned, we've got 2 tiers. The private and the public. Public sector is then state funded, and it's looking at majority of the people, 71% according to the stats last year. And the National Health Laboratory Services then services that public sector. It's free for service, free in the sense that the government then pays the service level agreements with the different provinces that are then signed with the National Health Laboratories, where work comes in, we process the specimens and out results, we'll send a bill at the end of the day, and the provinces, when it's convenient or they have money, they'll then be able to reimburse the NHLS for the services that have been provided. The private sector is largely funded through individual contributions, and the medical aid programs are then coming in. It's servicing 27% of the population, and there are many private laboratories in the country, over 200, and then the laboratories will claim from the medical aids, or people will then pay from their pockets for the services. The theme in South Africa is that healthcare is free. As a result, if you are to go into any health facility, either a clinic or a private, if it's a public health sector, then you are not going to pay for those services. Even if you have a medical aid program and you need to access some of these facilities, you are not going to pay unless then there are necessary arrangements to be done. However, we don't have a national laboratory quality framework in South Africa. I've tried to look and ask different people from the ministry offices. We don't have it. However, so the presentation was not that easy to prepare, but what I did is that I looked at the framework that has been published that we're going to be going through in this week, and said, if South Africa had it, or what is it that we have in the country that is then already complying with the requirements that are in that framework. So the guiding document was then used really as a tier to guide the headings that I'm going to be addressing, because I then thought, if we're going to be talking about these guidelines and how to implement, if we were one of the countries that are funded and we had our own con and we were going to come in, where are we complying? Like earlier on, we were told to identify gaps. What are our gaps, and how are we then complying with the things that are there that would have then been put in this document for our country? So, as far as standard is concerned, South Africa has a standard, South African Bureau of Standards, that established many years ago in 1945. As terms of, that was when the Act came, and later the Act was modified in 2008. And then the main mandate is then we'll develop and promote and maintain the standards. We call them SANS. Most of them are equal or similar to everything that is in ISO. Where there are changes, they will then come in. So you'll find that if you were to buy a standard in South African Bureau of Standard, you'll have ISO 15189-2012, but because our MIRA committee delayed in publishing it in the country, it will be SANS 2024, 15189-2014, no, not 2014. So you'll see that most of the standard will try and ensure that they come out at the same time, like 9001, we were right, 17025, even though it was late in the year, we managed to get it right. And then we will promote then the connection with trade and everybody else and render the services. And there are many MIRA committees then that are serving in the country to ISO, and participation and membership is full. On accreditation, South African National Accreditation System, SANAS, is recognized by the country through an Act 19 of 2006 as the single national accreditation body. It has membership with the African Accreditation Corporation and International Laboratory Accreditation, and SANAS is 17011 accredited as well, with several peer reviews coming up several times. Coming to licensing, which is then in the guide, there is licensing for the laboratories and licensing for personnel. When we look at licensing for the laboratories, then the laboratories will then apply to be licensed. There are requirements then to fulfill. Then there will then be a license and a practice number that you are then given in order for you to have a diagnostic laboratory. It's not open to anybody, however COVID shows us, I can't say flames, but different efforts by different people to be able to run the laboratories. And then you'll then get that number. Any laboratory professional is allowed to then up to medical technologists, scientists or pathologists, then to have the laboratories through the Department of Health, Health Professions Council, and Board of Funders as well. So for personnel, we register with Health Professions Council. It's there and has been then established in 1974. We then are registering and paying annual fees. The main aim is then committed from the HPCSA then to protect the public and look at us, and we pay as professionals in order to become there and maintain the registration annually. And the HPCSA then has different boards for different healthcare providers. So for medical doctors, then there will be a board of medical and dental practitioners. There's a board of medical laboratories that looks at different tiers of medical technologists, laboratory scientists, technicians, and others as well. So there are different boards that are looking at different practitioners. Coming to the NHLS. As a result, much as I looked at the framework, I wasn't able then to cover a lot from the private sector in the country. A lot will be similar, and if I remember, I'll then be able to say that. However, from now on, I'm going to be concentrating on what we are doing in the public sector laboratories. So we also formed, following an act in 2000, and to provide and establish a national health laboratory services. Prior to that, there were many different bodies, provinces, institutes that were running, and the idea mainly was abolish the existence of those and form one public laboratory service, and the activities commenced in 2001. The footprint is in all 9 provinces. We physically have 216 laboratories to date. The number keeps on going back and forth. Where we don't have enough professionals to be able to run that, the laboratories could be closed. However, in those facilities, we have depots because NHLS will have presence in those hospitals where then specimens will then be received. There may be people that are then collecting samples and managing results and things like that. And there are 10 national central laboratories linked to the medical universities in the country. The NHLS provides services, as I said, mainly to the public sector. However, we conduct also specialized tests to most of the private laboratories. We are the reference laboratories as well as referral laboratories for other countries, depending on the needs. We employed at this stage, including grant-funded personnel, about 8,000 staff. Our head office is in Sandringham, and most of you have seen the building at the bottom of the slide. Our vision is to render effective patient-centered service and global center of excellence for innovative laboratory service, and the mission is to provide quality. I was happy it started with quality. Maybe I'm biased. Quality, affordable, and sustainable health laboratory services. We're looking at training for health professionals, and execution of innovative and relevant research. So those are our three mandates within the NHLS: provide diagnosis, conduct research, and also train as well. Not very good, but this is the slide. So from the minister's side, so this is how our structure looks like. Here's the minister, then there's a board. We are appointed as an entity within the country. As a result, we don't get funds from the ministry to be able to run. Theoretically, we have to provide a service, raise funds, maintain ourselves, and be able to run. So some of you are aware of the South African Airways. Maybe I'm not a good example, but we run similar to SAA. And ESCOM, if you haven't experienced load shedding, thank you. But chances are during this week you will see it. So we run similar to that. We have to generate our own funds and generate. So we have a board. And the chairperson of the board then reports to the minister, and the nth member of the board is the chief executive officer of the NHLS, who serves there. And under her, then there are different executives, directors, NICD, director, National Institute for Occupational Health, and different executive managers for laboratory services, IT, HR, finance, etc. So NHLS has a strategy, and it runs over 5 years. And in that strategy, the strategy is signed by the minister, the chairperson of the board, and the CEO, and it contains and includes different areas, but I'm limiting this now to quality assurance related issues: accreditation of laboratories, certification of support service departments, provision of PTS, EQA, and internal audits. Those are targets in the strategy in the NHLS, and it's looking at, on accreditation, it's looking at different tiers. In the NHLS, we have 4 tiers. I mentioned the National Central Laboratories. There are provincial tertiary laboratories. We've got 17 regional laboratories and district laboratories that are existing at this stage to make that number that I said keeps on going up and forth. Then, when we look at the NHLS, from the beginning when NHLS was formed, there were rules that then came and guided how NHLS is going to operate and come. There were rules that are set up to guide, and there's a chapter 6 that only concentrate on quality assurance. And in there, it guides what has to happen. One is the provision of a proficiency testing scheme, the health technology assessment in order for us to evaluate the in vitro devices that are coming in, equipment, reagents before they are used, looking at documentation that are needed for the laboratories and managing them from head office, monitoring and compliance for different QA-related activities, including internal audits, and the implementation then of quality management system in all the laboratories at different levels. We have a quality policy. We have one policy for different ISO standards. We ensured that it complies with all of them that we have: ISO 15189-2012, 1702-2012, 17025-2017 for testing laboratories, 9001 for media production, at the same time as support service departments like IT, finance, QA, and ISO 17043-2010 for proficiency testing scheme. The policies then reviewed at National Management Review meeting by then the CEO, executive managers, directors, area managers, and the quality managers when they meet. Then for the EQA or PTS, participation is compulsory. The chapter is clear. All NHLS lab mandatory will participate in the proficiency testing scheme. However, enrollment is not limited to South African or NHLS laboratories. The private laboratories and public laboratories also participate from other countries. And at this stage, the number has decreased. At a certain stage, we had 25 laboratories or countries participating. We're at 17. Funding over the last 3 years dropped for different reasons that you are aware of in many areas. As a result, enrollment on the PTS was one of the things that were then compromised, other than different than preferences for people to go and participate. So we introduce the schemes by different ways. We either pilot, every year we are piloting new schemes. There are different experts that bring in things. Some of them we acquired when the NICD became the National Institute plan to get it as a public health institute for South Africa, and the mandate then changes and does no longer then include EQA. However, there was technology transfer as well for CD4 through Quasi from Canada, Africas into the NHLS, but at the same time with CDC, with the EIDs and the viral load, there was technology transfer as well. To date, we are offering 35 proficiency testing schemes. Our latest then increases now has been the molecular SARS-CoV-2 and the antigen one, and they are in different disciplines below. What we did is that we then wanted to standardize the processes in order then to try and win the accreditation battle. We standardized processes. The country has one quality manual that's running across different ISO standards, and all the laboratories are using that. And I'm saying the country, but I'm saying the NHLS laboratories because I am excluding the private labs. So we designed one quality management system, and the quality manual then dictates many standardized processes within. There are common IT, safety, HR, finance policies that all the laboratories comply. We've got a centralized document control system that we manage in the office and head office, that any lab in the country is able to access those documents in order for them then to comply with the requirement of the standard, but also then to manage laboratories as well. There are more than 30 at this stage that we managed to standardize. We've got one handbook that all the public facilities are able then to access that we are using. As far as personnel is concerned, on training for the professionals is done at different stages. So here, the first one, for the pathologists and medical scientists, that in collaboration with the medical schools, NHLS is the only organization in the country that's training the pathologists and medical scientists. However, together with the private laboratories, we train the medical technologists, medical scientists, medical laboratory scientists, technicians, and lab assistants. So for quality management system training, we do it in different ways. At the beginning of the year or during performance review, managers and employees will then decide on gaps to train. However, there are those things that are then decided by management that people have to train. And QMS maybe is an example of those courses that will upfront be identified. Then the people will then enroll for training. After the courses have then been approved, people will then go for training. There's training that we do in-house because we've standardized many processes, so it works better when you train people on how things are done internally. But we use external service providers. An example is SANAS, and then we also then use other people as well to be able then to train. However, in addition to the NHLS one that's done and managed at national level within QA, there are in-house, in-laboratory training that is being done by different managers or coordinators at different stages. So the process to accreditation is that there will be a plan, there'll be commitment from management. It will be part of the strategy annual performance plan and key indicator for a relevant manager for that process, those laboratories to be accredited. So a plan is then drafted. We use SLIPTA checklist guided us in developing a form of checklist, checking the requirements, and that we use. We created a special form. Monthly managers check there. Quarterly, there will be self-assessment and reports that are coming. The local QA people will then be auditing. Our QA structure has coordinators for every 10 to 17 laboratories, a QA manager in about 30 labs or so, and then it comes to national level. So they will conduct the local audit, and when they think they're ready, they'll tell head office, we are ready, we think SANAS can come. National Head Office Monitoring Department will then identify experienced auditors. Majority of them are already SANAS assessors who assess private laboratories, but some are experienced members to be team members for the final audit before we go SANAS. The idea was we didn't want to to spend a lot of money and waste it by not being accredited. And I must say that over the years, there's an improvement. In the past, most of the labs were not successful, but nowadays we do get labs that they get that audit once. We do have labs that we say, fine, you'll pass during your 4th audit. However, at the end of the day, they do go through. Then when the team says they're ready, they recommend the lab then gets accredited. So some of the results that we have seen so far in the system that we have 4 departments that are 9001 certified, including the QA. We have only 1 lab in the NHLS that's 17020 accredited, it maintained it. 3 of the 5 are 17025 with the acquisition of the forensic laboratories. The number of 17025 laboratories in the NHLS will increase from April this year. But by the end of April now, like last month, we managed to have on ISO 15189 110 laboratories that are SANAS accredited at this stage. The distribution of those laboratories is in all the provinces, and there are very few districts that don't have an accredited lab. This graph takes only unto the financial year that ended in March, and some laboratories were recommended then in April thereafter to be accredited. And as far as monitoring and evaluation is concerned, we have audits. We conduct different audits. Internally, we audit at least once a year. Each lab will accredit. It's part of the annual performance plan, and that performance is then measured at that level. There are then monthly reports that then come in and report, and they go up to executive level on the progress on implementation of QMS. And some labs may have more than 1 audit depending on when they are ready. If we audit a lab and we recommend they are ready for accreditation, the local QA will then go in, and they may end up even getting a final audit before even SANAS 2 or 3 in a year, depending on the time of the financial year when they then were identified as being ready. But those that are accredited may then have several audits internally that are more focused at different tests. So for external assessment, at least once a year, there is one, unless there are challenges. And I must say that we were very proud and happy that during the COVID, we were worried that most of labs will lose accreditation, as we were losing even people in the laboratories, but all the labs managed to maintain that. Monitoring also happens at management review meeting. That happens at different levels and tiers of the laboratories. So there will be some for the laboratories at business unit level, at area manager level that are happening, and some executives as well, where monitoring is then done. And in the annual performance plan, quarterly, we then send an update. This is where you are, this is what the target was, these are the reasons why we didn't make it, or this is the reasons why we are over then delivering or performing in those areas. At the end of the year, for the strategy, we do submit. The strategy has been signed by the minister. We are then audited by Treasury in order for us then to be able to comply to all those 4 requirements that I mentioned that are related to quality. I think what is working in many areas is the performance agreements. Many managers, all laboratory managers and executives or area managers and coordinators, QA managers, as we have accreditation as part of the key indicator for annual performance. So that then drives people to come in. Then it is then depending on where you are, obviously the measurement will then differ, but this is one area that also then assists, because fortunately you may get 1% or 0.5% increase if your performance is then met with other things, obviously, and not that one. I just want to say thank you for listening to me, an opportunity. Thanks to the organizers for allowing me to come here, and to all the staff that work with us. And I must say, I was saying to Ferry, I'm lucky where I'm working. We've got many committed men and women that are working for the NHLS tirelessly to ensure that the quality management system is not only maintained, but then improves, because the more labs are accredited, the more it's difficult to maintain them going forward. And most of these have then been, as Beatrice was saying, over the last 5 years, we saw many of the laboratories then coming in as well. I thank you.
Thank you very much to Patience. And I hope that her presentation has given us some encouragement that this is achievable. I mean, it's taken years to develop a system as structured as South Africa's, but we have a starting point, right? So it's one step at a time. So thank you very much for that. So before we go head to lunch, we're going to have a question and answer session. We have some questions from our online audience, and we had some questions that needed to be addressed in the room. So let me start off with a couple of questions that we had from our participants online, and then we'll move to some questions in the room. There is a question here to Teferi, I believe, and the question is really about SLIPTA, and it says that the question is asking, number one, basically, how does the SLIPTA program work? There were lots of questions related to how do I become a SLIPTA auditor? How do we get the SLIPTA program in our lab, etc. I know some of it was covered in your presentation, but if you can just give a brief summary overall about implementation of the program and also trainings as a SLIPTA auditor, I think that will address a lot of these questions. Thank you.
Okay, thank you, Beatrice. With regards to how anybody would become SLIPTA auditor, actually to start with the request from the country. The Ministry of Health would approach ASLM or any implementing partner that is supporting a given country would approach ASLM to train a number of laboratory professionals. Then we can train people because we do have a standardized curriculum and arrangement so that we can deploy our certified and lead trainers to train laboratory professionals to become the auditor. But we do have a procedure again. After the training, there is a requirement that each successful participant would be attached 3 to 5 ASLM official audit to be certified because they need to get a practical perspective of this program so that we can declare that they would be certified and can do the audit independently. So this is the process that we have at ASLM, and this is how we support professionals to be trained and become ASLM certified auditors.
Thank you. There was another question here which I'm going to direct to Dr. Pascal, please. The question says that, what are we doing in view of the fact that we have talked about the fact that Africa is lagging behind a lot in terms of accreditation in QMS implementation? As ASLM, as the body profession at the regional level representing the lab, how are we engaging with countries and with heads of countries to really promote QMS implementation? So I would like to.
Thank you for the question. So I think it's an ongoing process, and I think everywhere ASLM is working, we are promoting quality. It took a long time to think about how can we do that in a cost-effective way. So I think that this is a step where we have 14 countries here. We hope to have more. We even hope that after this work, we can have a very solid position or declaration about the QMS to support our advocacy efforts. And in some countries, I mean, although it's not very visible, you will see that in a country like Cameroon, we really started to put into practice this QMS laboratory quality to move on as a national system or a national program. So we are already busy doing this. I would like to add that we have conversation with the West African Health Organization. They also, we work hand in hand or with EXA to implement QMS, but it's a long process. Yeah. Thank you.
Follow-up question, please, Dr. Pascal. There was another question about whether ASLM, the cost of accreditation, and saying that sometimes the barriers to gaining accreditation comes from the cost of accreditation in itself, and the fact that, you know, even the initial assessment and the follow-up surveillance and reassessments are expensive. Have we, as ASLM, thought about engaging with the accreditation bodies to look at costs for regionally based labs or African labs so that maybe the cost can be more affordable to labs in Africa?
Yeah, that's a good question. So I've done a quick research, and I think in accreditation, the cost really for the visit, etc., it can go from $1,500 US dollars to $9,000 to even $10,000. Actually, if we look at those costs, that is really very small as compared to everything that a laboratory has to maintain to keep the accreditation and the standard. So I think it's a good idea to speak with the accreditation body. What would be even more important is to raise awareness for not only the facility, but also the government and the local authority on how much it costs to actually keep quality. And some of these become a bottleneck when we say accreditation for all. we would like that it happens, but it has to be realistic that some of the reference laboratory will go to accreditation and probably they have a business plan that can support this. And for other laboratories that are well-resourced, we need to find intermediate options for them to maintain their quality, but not necessarily go to accreditation. And I think that's what this guideline or blueprint is all about.
Thank you, Dr. Pascal. Mr. Ndlovu, please, if you'd like to take the next question. It's about training institutions. So we know that basically there is a lack of QMS training pre-service, and most of the QMS training in our labs is done post-service. And there was a question about whether we are thinking about, again, coming to engaging with countries in terms of really promoting pre-service QMS curriculums and maybe supporting countries to develop these curriculums as a step towards, really incorporating QMS as part of our structures, our systems.
Thanks for that question. So I must say that this is still work in progress. We have learned a lot in the last 10 years during the implementation of quality management systems, realizing that we need to start engaging training institutions. And at some point, really some of the observations and some of the trainings that we were giving, even at in-service level, we were now seeing that these now needs to be incorporated into some of the pre-service curriculums. We have attempted in some universities, but I think this is a conversation that should be ongoing and really bring the universities on board so that the cadres of people that are qualifying are really up to date on these QMS developments.
Thank you. There was a question, which is it's a dicey question, but to ask, and I'm going to send that to Linda, please, as a neutral person. Linda chaired. There was a question that says, or it was a statement that says, do countries need to have a directorate of lab? And it was in capital letters. So the person was serious about that question. And it says, it was more of a question to say, to do this, do we need to have directorates of labs? And I think it was more of a statement as well as a question. Yeah.
Well, then I make a statement as well, yes. I'll give a little bit of reasoning behind that. We've seen a lot in the past, actually, that the laboratories have been neglected. I think everybody recognizes that. One of the things is that many laboratories fall under, are located within a hospital setting, where the clinical care, and it's kind of logical, the clinical care always gets precedence over the laboratory. So what do you see happening if there's insufficient budget? Okay, let's cut the laboratories and let's actually give that to clinical care. If you want to do proper advocacy at all levels, it is important that up to the Minister of Health, everybody realizes the importance of laboratory services. So that actually, as I think Chet already mentioned, we are the eyes and ears of the clinical care and of the public health and global health as well, of the health surveillance. But in order to fulfill that function properly, we need to have all the tools we can get to actually do our work properly. And if you have a directorate of laboratory services with direct access, I mean, I would add that, with direct access to the minister, you actually have a better way of advocacy, promoting your position within the total health system. And I think with Ebola in West Africa in around 2015, and now also with COVID, I think it has been shown more than enough that how crucial good laboratory services are. I hope that answers the question.
Yes, thank you, Linda. Dr. Pascal would like to add on to that, please.
Yeah, thank you very much. I think that when we talk about advancing QMS, there are important administrative and regulatory functions that need to be done. We know some divisions or departments need to develop the policy and validate it. That is normally the work that comes from the Directorate of Lab. And then you have the technical arm that is really going now to implement QMS with all, you know, with all the EQA, all those elements, etc. And that's important. And many times it is the National Public Health Laboratory, but it doesn't matter what you label it. As long as the functions are there, you have the administrative and regulatory function, and you have the technical arm, and they are complementary to each other. I mean, however the country organizes it is just how they organize it, as long as the functions are well defined.
Yeah, I think I like that. Between the two answers is a compromise, because the word Directorate of Lab has led to blows in meetings. We can all attest to that there is some kind of emotiveness that comes with that statement when it comes to policies. And I'm sure that we will have discussions about this in the next coming days. But I agree with Dr. Pascal that the name is not important, it's the function that is really important, that they're able to function and have, as Linda said, have direct access to the level at which decisions are made. That is the key thing for the lab. Decisions are made for the lab, and that we are represented in those discussions and those decisions. Yeah.
I even know one country, have experience in that country, where the National Public Health Laboratory has both functions, the technical arm, but also the kind of directorate of laboratory services. And as long as the minister follows the advice, I mean, I'm perfectly fine with that. Ultimately, it is about getting things done.
Thank you. So, question? Please. So, for the English speakers, please put on your headphones. We have a question for.
And from the Directorate of Laboratories in Senegal, I would like to intervene in this exchange as we are speaking about the direction or the Directorate of Laboratories regarding the network of laboratories. I would like just to give the experience of Senegal, my country, and we have a national network of laboratories. It was created in the year 1998. And formalized in 2005, and by creating a directorate, a national directorate of laboratories in 2012, we saw that there was a better structured approach of laboratories, particularly when it comes to quality management. In Senegal, our policy was to adopt the norm of
Et il y a eu un pool d'auditeurs qui a été formé. Et d'ailleurs, nous en profitons pour faire un plaidoyer pour qu'il y ait davantage d'auditeurs qui soient formés pour couvrir le réseau des laboratoires qui compte plus de 180 laboratoires à tous les niveaux de la pyramide sanitaire. Donc, pour dire que nous avons eu l'initiative d'auditer tous les laboratoires. C'était difficile parce que nous n'avions pas suffisamment de ressources. Et il y a eu 20 laboratoires qui ont été donc identifiés comme ayant eu un score assez respectable et ces laboratoires ont été ciblés, donc on les appelait les laboratoires de première division par rapport aux autres laboratoires qui avaient eu un score plus faible. Et notre donc, perspective, c'était de les suivre et pour aller au bout jusqu'à l'accréditation. Donc, on était très ambitieux. Nous nous sommes rendus compte qu'il fallait modérer notre ambition. Et d'ailleurs, ce suivi-là a été difficile. Ça est tombé à l'eau. Et maintenant, ce que nous souhaitons, c'est donc refaire notre audit qui est plus actuel pour voir où nous en sommes. Et au lieu d'aller directement vers une accréditation, nous pensons à mettre aux normes non laboratoires. Donc, sur tous les plans, comme ce qu'a présenté tout à l'heure, je crois que c'est notre ami Oscar, je ne veux pas me tromper. Donc, Oudoubala, en tout cas, sur la perspective de voir tout ce qui est soutien, coordination de ces laboratoires avant de passer au niveau supérieur. Je ne parle pas des laboratoires de référence qui, eux, peut-être peuvent aller directement dans une perspective d'accréditation. Mais le plus gros de de nos laboratoires n'en sont pas encore là. Et vraiment, c'est un plaidoyer fort pour donc nous appuyer pour la formation sur l'audit et également pour mettre au nom nos laboratoires.
so that we can advance it. Thank you so much.
Thank you too, Mercy. And I think the key message from the comment is that having a directorate, a lab directorate, helps you to better coordinate the labs and laboratory services throughout the network, and that is what the process that Senegal has started with. Richard, I saw your hand up, please.
Thank you very much. My question really has to do with enforcement. I see we have a lot of resolutions, declarations, and all that countries sign up to. But is there any framework for enforcing the implementation of these resolutions that countries sign up to? And if ministries of health are not able to make progress with implementation, are there mechanisms to ensure that whatever they've signed up to, they are able to make good their promises? Otherwise, I saw 14 years of Maputo Declaration and stuff like that, but countries are not making progress. So do we have a framework for enforcement? That then it doesn't become just mere formalities, but then these declarations, when we sign up to them, then we enforce that they are done. Thank you.
Thank you. So I'm going to take it back to to Africa CDC, AU Africa CDC, Dr. Itenu, and then I'll ask Dr. Pascal and Mr. Ndlovu to add on. Thank you. That's a good question.
Thank you so much, Richard from Ghana. It's a very good question. In fact, there is no any enforcement. In fact, the Africa Union and Africa CDC health strategy have been established, which have been reflected. All member states have been agreed on to establish strategic plan and other related health issues. And with that, there is an agreement that has been put in place, but there is no any such enforcement. But annually, there is an audit which have been presented by member states so that they evaluated where they are in terms of a progress. A different issue related health lab and the like. Thank you so much.
Thank you, Dr. Itenu. Dr. Pascal.
Thank you. That's a very good question that is going to bring us to some philosophical discussion. So one of the few framework that is enforceable are the IHR. I mean, beside the IHR, it's a policy to recommendation and you know, countries or facilities may or may not follow. But having said that, it's important to then start to raise awareness of the country. Why should they have a policy? Because without that policy at country level, you cannot enforce. You know, then you will have a few regulations that then can enforce at your country level that you comply to some of those requirements. However, even the policy, you will realize if you work with country that the policy stays in a draft for many years. And why is that? Because as soon as the policy is validated and endorsed, then as a government, you should put the resources available to enable then your facilities and your establishment to actually comply. So it's a little bit of a tricky situation. What comes first, the policy and then the enforcement, or the enforcement or then the policy? But it is a process, and we hope that this blueprint will be the first stage through which the country, you know, some of the countries that are ready will validate, they will endorse, they will make sure that they have this enabling environment. And importantly for the partners, because partner support was also considered as a key to advance QMS. It will be very important when partners come with resources that they then support a policy that is already there, as opposed to try to implement some fragmented intervention. So I hope that partly answers your question.
Thank you. Yes, sir.
Thank you very much. Good afternoon, everybody. I am Dr. Musonda from the Zambia National Public Health Institute. So my question is related to the presentation from the South African National Health Laboratory Service. But I would also appreciate some comments from Africa CDC, Dr. Tenu or others. So twofold. First of all, regarding the new public health order, where we are all agreed essentially that public health is more than just human health. We have the animal health context, or more broadly, One Health. So how do we fit that context within what we are discussing, which in my view so far is more human health biased? But also, in the other context has to do with the amount of resources, especially in the South African case that we so wonderfully heard about. How is One Health being incorporated within the system? My second question was to do with the level of resources that are required. The South African system works very well, but I think the presenter did mention that they are not getting funding from the government. So how are you managing to get the financial resources to sustain, that institution, and also that workforce of 8,000 plus that we heard about? A small one maybe you can comment on is within that 8,000 workforce, what proportion are actually technical staff and what proportion are like admin supportive staff? Because I think that's a very important aspect that maybe we tend to neglect so much. Thank you very much.
Thank you too. I think there are two questions there, so I'll ask Dr. Itenu as you were asked to comment on. The first one is, moving forward, how do we ensure that our initiatives and our activities have a One Health approach where we incorporate animal health, similar to what we're doing with EQuAFRICA, animal health, environmental health, etc. Then the next question I'll address to patients. Please go ahead, Dr. Itenu.
Thank you very much, Dr. Musonda. It's very critical questions to highlight One Health issue. And Africa Union and Africa CDC brought up this issue and developed a sort of strategic framework to include a One Health approach at this point in time. So this is very important and mandatory with existing pandemic and epidemic in the continent. So that regarding to the quality management systems and quality issue has to be, of course, incorporated. Along the side, we have a different regional partners through NEPAD and WHO have been also participated in that line, Global Fund and WAHO. And these are important partners who are going to be leading and supporting the African member states. So we support that. We strengthen the activities that have been implemented through the policy and guidance of the member states' health ministries. And with that, we are having followed the strategy plan that has been also, included the One Health in the system. So we are not alone simply just to support the human health, but also animal health is very essential because many of diseases come up from zoonotic, so that that issue have been covered through surveillance and disease emergency unit and other public health institutes has to be addressing this issue properly.
Thank you, Dr. Itenu. Okay. So just let me ask patients to address the second question, and then we're going to go to lunch. We have one more presentation after the lunch break, and then we can field some more questions after that. So patients, the question was resources. How do you manage your resources if you're not directly funded by the MOH? And of that proportion of 8,000 staff you mentioned, how many are technical? What proportion is technical and managerial or other positions? Thank you.
Thanks very much for the question. What happens is that, as I indicated, there are service level agreements then that are signed between provinces and the National Health Laboratory Management in that level. However, even though the agreements are signed, pricing is decided at national level. So from the Ministry of Health, Then and Treasury, there are agreements on the tests. Majority of the tests are fully costed, and as a result, we know exactly whether we're running at a loss or the price is lower. There are many tests where upfront we know that for instance, viral load would be more expensive compared to what we are charging the public health sector. So that then happens at different stages. So much as prices are agreed at national level, the agreements are at provincial level because that's where the money is coming from. Mm-hmm. Tests are then run. The request will then come. There are gatekeeping systems that are there that may prevent any practitioner to ask questions or requests as they want. However, tests come to the NHLS, and any test that came, we then have to conduct. We then send a bill to the different provinces or hospitals or whatever directors at that level. They then respond, but in order to ensure and encourage some of them to pay timelessly or at least within agreed turnaround times, within the finance department, there's a department of debt collectors or something like that, where they will then follow the people and ensure that money then does come in. However, it's always a challenge then to balance what needs to come. My understanding is that what happens is that top management will ensure that there's always enough money to cover salaries, and there's money to cover then the basics running of the tests. As a result, what I couldn't show because of time is that the system that Linda was saying, we also implement where not all tests are run everywhere. Some of them are centralized, and those are some of the reasons for efficiencies. So as provinces then do pay or hospitals do pay, I think that majority of the managers at business that are running the lab spend most of the time convincing that the people must then pay in order to ensure that NHLS is able to run. If money is not enough, you see challenges where for CAPEX you don't get everything that you want. However, salaries are also then going to be there. And when things are challenging, there are discussions with big companies or suppliers where I think top management will then, CFO, CEO will then meet with Roche about, as examples, I don't want to advertise in but big companies and say, can we pay you next month or after so many days, can you bear with us because we're waiting money? However, there are several grants that are then used, even though I think about 7,000 of the employees are paid by the NHLS, and I stand corrected, there's a huge amount of employees that are paid through grant funding. And depending on availability of those grants, some of the contracts may not be renewed, others are renewed. There's a teaching model as well with the medical schools where joint appointed staff are there, and there are agreements on the Department of Education then paying for a certain portion of then education, and the model for funding for NICD is also then changing over time because NICD is not limited to the NHLS only, it's a national then entity. I've summarized it, but I don't think I have it all, but in summary, that's how then it works. On the workforce, I'm not sure of the percentages. I can clearly say more than 70% of the people are in laboratories and on diagnosis, but I don't have the exact number and I don't want to lie. Majority of non-diagnostic laboratory people are based in head office, even though there are regional offices in different places. Majority of the staff are in the laboratory producing tests or training or conducting research, and I'm sorry I don't have the exact number or that ratio. Thanks.
Thank you, Patience. And I think the key thing from that is the control of your internal, number one, the ability to internally generate your funds, so to charge for your services and having control of those funds. I think in a lot of our countries, even when we charge, we send the money to a central level, it's not decentralized, and then we don't know what happens. And then we generate so much and get 5% back in the budget. And so I think one of the key things here is that decentralization of funding, where the NHLS can collect their own revenue and use it in terms of the implementation of their strategic plan. So on that note, I'd like to say thank you to all the presenters and to all the participants and everybody who joined us online for your participation. We have an hour for lunch, please. Can we be back by 2:15? Yes,
no,
Linda.
Because then we lose a lot of time for the actual country teamwork. So I would prefer if we could be back in 45 minutes.
45 minutes. So what time would that be, please?
10 past 2.
Okay, so 10 minutes past 2. If we can be back by 10 minutes past 2 so that we can start the rest of the session. For those of our participants who are joining online, we have one more presentation which you may be interested to participate in before we go into our team sessions. So we ask you if you're able to join us again at 10 minutes past 2 for the final presentation of the day. Thank you very much, everybody. Enjoy your lunch. We hope that you all had a nice lunch. Let's move ahead with the program. Our next presentation is going to be from Cameroon, and they're going to give a presentation on their experience of developing their laboratory policy. So the title of the presentation is Policy and Planning for QMS Advancement, the Cameroon Experience. So can we invite Dr. Diallo and Dr. Mbwe? I hope I got that correct. My apologies if I didn't. Okay, to give the presentation. Thank you.
De la planification,
the planification,
de la mise en œuvre de la politique
and the policy, the quality,
dans l'élaboration de la politique nationale des laboratoires au Cameroun.
Elaboration of the policy and planning to advance QMS in Cameroon. This presentation was elaborated in collaboration with Dr. Samba, of course.
Il y a quelqu'un qui zappe ou c'est moi qui zappe? D'accord, merci.
Well, thank you very much.
Donc, comme plan de notre présentation, tout d'abord, nous allons faire
the outline
une brève
of our
du pays.
presentation will include a
Par la suite, nous allons
presentation of
présenter
Cameroon,
le réseau, le système
our country, and then we are going to present the laboratory
comment nous
network
avons
and system in
à peu près
Cameroon,
utilisé ce document,
and
cet important document
how we
nous a proposé
used
Africa
this
CDC.
document proposed to
enrichir
us
notre
by
politique
Africa CDC
nationale de
to enrich our
terminerons
national
en
policy
partageant avec vous nos prochaines étapes, mais aussi
for
les
laboratories. We are
challenges
going to
et les leçons
also
apprises
speak about
lors
next
de
steps and
l'utilisation non
challenges
seulement de ce
and
document,
lessons
mais aussi de
learned, not
l'élaboration
only
de la politique
while
des laboratoires dans
implementing
notre
the
pays.
NLQF, but
En
also
guise
doing other
de
activities.
présentation vraiment résumée du Cameroun,
So,
il faut dire qu'il ne faut pas seulement regarder que le
Cameroon,
Cameroun, c'est le pays de Samuel Eto'o,
Cameroon
ou
is
que le Cameroun, c'est le pays qui
Eto'o,
a montré au Real de Madrid comment gagner les
the
matchs perdus
country
d'avance.
that shows
Mais il faut
Real
garder
Madrid
surtout que
how
le Cameroun,
to,
c'est un pays qui se
win.
situe en Afrique centrale.
But otherwise,
C'est un pays
a
qui parle
country
français et
in
anglais.
Central Africa, a
C'est un
country that
pays
speaks
qui a une
French and
superficie de
English,
475
with a
442
superficie
km
of an area of
et qui est administrativement réparti sur 10 régions
442
et avec une
square
population
kilometer
d'environ
with
25 millions
10
de personnes.
regions with a population of 25 millions of people.
Pour ce qui est du secteur de santé,
Regarding the health sector,
dans notre pyramide sanitaire,
our
qui va des hôpitaux de première catégorie jusqu'à au niveau périphérique, on peut quand même trouver 360 laboratoires qui ont été cartographiés dans le cadre du dernier exercice qui a été mené
during the
dans notre
last
pays.
exercise that was done in our
En ce qui
country.
concerne le réseau
Regarding
des
the
laboratoires,
laboratory network now,
il suit la pyramide sanitaire du
so
Cameroun,
we have the health
où on a
pyramid
effectivement
of
donc 4
Cameroon,
paliers. Mais
to
sur la
which
structure,
it's a line, and it has 4 tiered
5, pourquoi? Parce
levels.
qu'on ira
You see 5, but
des
why?
structures, des
Because
hôpitaux ou
we
des
move
établissements qui se
from
trouvent au niveau des
hospital
hôpitaux de référence, au niveau de la région,
from
au niveau du district,
referral,
des établissements de santé, mais au
tier
niveau communautaire.
to
Les
region,
laboratoires, on les
districts,
regroupe en
health
4 paliers.
centers
Pourquoi?
and
Parce que pour nous,
community.
le niveau
For us,
communautaire
it's
est directement
4
parfois
because
rattaché
community level
aux
is
établissements de santé.
mainly linked to
Donc, les
health
agents de santé communautaires et autres qui vont au niveau
centers or
périphérique
establishments,
pour
and this
utiliser
is
les
why
tests de diagnostic rapide et tout,
we
appartiennent
do their
généralement à des centres de
fast
santé
diagnostic
auxquels
tests
ils sont rattachés.
and for assay.
Tous ces laboratoires,
So,
quel qu'en
it's
soit le cas au
4
Cameroun, sont
tiered
répartis dans le
level
secteur
for
public
us.
et dans le secteur privé.
In
Mais il
public
faut
and
également noter
private sector,
qu'outre
but
les
it
laboratoires
is
qu'on trouve
good
dans le
to
secteur
for
public,
laboratories
il y a également
in
des
public
laboratoires
sectors. You also have
qu'on trouve dans les hôpitaux. Je veux dire, il y a des laboratoires
in hospitals,
qui sont dans le secteur privé qui n'appartiennent pas aux formations sanitaires, mais également des laboratoires publics qui n'appartiennent pas aux formations sanitaires, notamment le laboratoire national de santé publique. Mais on trouve également, notamment dans les universités,
and in
des laboratoires de
universities, you
recherche.
can find also research laboratories.
Alors, tous ces systèmes,
So
quel est le système qui est mis en place pour pouvoir soutenir ou permettre à ce que ce réseau fonctionne?
does enable this system to work efficiently. So Cameroon has a laboratory system. You have a regulatory framework, laws, decrees, decisions regulating the profession. We also have a national laboratory strategic plan. And it will, as you see, expire this year in 2022. So we can update it further. And we also have various operational and guidelines documents, just as the good execution of analyze guide, the biosafety and biosecurity guide or manual, and the certification.
Du personnel concerné par les points of care dans la prise en charge du VIH/SIDA. Alors, il faut dire que, en dépit de l'existence de tous ces documents-là, jusqu'au jour d'aujourd'hui, le Cameroun ne dispose toujours pas d'une politique validée ou du moins adoptée de laboratoire. C'est donc fort de la déclaration de Maputo. Je pense qu'on a déjà parcouru le matin, on a parlé de cette importance de renforcer le système de laboratoire, des obligations du règlement sanitaire international, mais aussi du total engagement du Cameroun au cours de ces dernières années à renforcer son système de santé, particulièrement le système de laboratoire, qui est clairement évoqué dans la stratégie sectorielle 2016-2027, mais aussi dans l'agenda de transformation du système de santé camerounais depuis 2019 from
2019.
Et l'importance également de disposer d'un cadre réglementaire où tout doit venir s'adosser. Il est important de disposer d'une politique nationale de laboratoire. Donc, c'est tous ces éléments qui nous ont obligés à vraiment accélérer le processus d'élaboration et de finalisation de ce document. Alors, quelles sont les différentes étapes que nous avons utilisées pour élaborer notre politique nationale de laboratoire? Tout d'abord, comme toute chose, il fallait d'abord faire une analyse situationnelle. Une analyse situationnelle où à partir de laquelle les données ont été collectées, les données sur le terrain par la direction de l'information et des laboratoires. Par la suite, constituer un groupe technique qui contenait en son sein des experts et des personnes bien informées du système de laboratoire au Cameroun, qui a donc permis non seulement de réviser cette analyse situationnelle qui avait été préalablement faite, et puis de réviser dans le draft qui a été fait section par section, comme on va le voir tout à l'heure. Une fois que ce travail a été fait, il y a eu une validation, un atelier de validation avec un groupe beaucoup plus élargi du draft que nous avons de notre politique nationale. Il faut dire que c'est un draft qui datait de 2013. Puis 2013, on avait déclenché le processus avec le temps, ça avait un peu endormi. Depuis 2019, ça a été accéléré et l'année dernière, donc, nous avons élaboré le draft 0. Et puis, au début de cette année, mars 2022, nous avons procédé à la validation de ce draft, puis nous avons défini les prochaines étapes. Il ne reste plus donc que l'adoption et la dissémination. Alors, qu'est-ce qui s'est concrètement passé? En janvier 2022, à Douala, nous avons convoqué une réunion qui comptait donc pour la révision de ce draft 0 qui datait déjà
for the review of draft 0 from 2019. And fortunately for us, this workshop came together, was held together with the publication of the establishing guidelines
sur la mise en place donc d'un cadre qualité dans les laboratoires d'Afrique, dont le guide NLQF par Africa CDC. Ce qui fait que lors de cet atelier, nous avons eu la chance d'avoir Béatrice qui nous a fait une présentation de ce guide pour nous permettre de mieux le comprendre, de savoir exactement ce qu'il y a à l'intérieur. Une fois que ce guide a été présenté, il revenait donc à l'équipe du pays d'adopter l'approche qui était la plus adaptée quant au document qu'il devait réviser. Alors, premièrement, il a été choisi de développer. Il y avait deux possibilités. Soit on allait développer une politique nationale de laboratoire en intégrant
les aspects
national policy
qualité,
integrating
ou
quality
alors
aspects.
il était question de mettre à jour ce guide national en utilisant
we have at national
le plan
level
qualité qui a été
using the
élaboré
quality
par
plan elaborated
Africa
by
CDC.
Africa CDC.
Le Cameroun a choisi, étant donné qu'on avait déjà un draft, au lieu d'élaborer une politique qualité différente, d'adapter initialement travaillé, ce qui nous a permis également de revoir l'analyse situationnelle et de mettre à jour notre version. Au terme de ce travail, c'est là où a intervenu la télé de validation à mars 2022, par un groupe plus élargi qui a pris en compte le secteur animal, le secteur de l'agriculture, le secteur privé, le monde académique, et ainsi que tous les acteurs,
laboratories,
le
agriculture
secteur privé,
laboratory,
etc.
and also the private sector.
Le draft 0 a donc été révisé, validé, et les prochaines étapes ont été
structures and others.
Et comme prochaine étape, donc, il était question, ou du moins il est question, ce qui se fait actuellement, de faire valider le document par l'aspect politique au plus haut niveau, puisqu'on a eu la validation technique des biologistes, de tout le monde, etc. Il reste juste la validation politique, puisque c'est le politique qui sera amené à mettre en œuvre des actions permettant que cette politique soit effectivement déroulée. Le Cameroun était un pays bilingue. On devra traduire notre document en langue anglaise, puisque nous avons initialement travaillé en langue française, et puis tout simplement une petite séance d'adoption de ce document, puis une dissémination.
Of this document.
Alors,
and then
pour ce qui concerne dans le NLQF, concrètement, de tout ce que je viens de dire, voici en résumé comment il a été utilisé. Premièrement, puisqu'il venait juste de sortir, il nous a été présenté, on a dit Béatrice a voulu participer avec nous en ligne, et nous a présenté le document. Nous avions également avec nous la présence de Dr Samba, qui est l'une des personnes qui ont élaboré le document, qui nous a présenté le document dans son ensemble, nous a présenté les différentes options. L'option première qui était d'avoir soit une politique qualité à part, ou alors, si on a déjà une politique de laboratoire, d'intégrer les aspects qualité qui sont invoqués, ce qui a été adopté par le Cameroun. Une fois que le document a été présenté, l'une des étapes très importantes, c'est qu'il faut lire et comprendre. Parce que ça a été présenté par Béatrice, mais il est revenu à toute l'assistance de... On a pris près d'une journée de travail où, dans les travaux de groupe, il était question de lire tout le document, de voir les visions qui étaient proposées, de voir les déclarations politiques, les objectifs qui étaient proposés, ce qui a donc permis de mieux comprendre le document et donc d'harmoniser la compréhension des différentes options qu'il était question de prendre. On l'a dit tout à l'heure, les deux options que forcément nos différents collaborateurs des autres pays auront éventuellement à exploiter en révisant leur politique sont les suivantes. S'il n'y a pas de politique
choose this option. If you do not have an NLP, the national policy, then you need to do one according to this guide. And if you have an NLP, you just need to update your NLP at your country level.
Les challenges.
So what were the challenges?
Ont miné le Cameroun dans
For
l'élaboration
Cameroon, the challenges to
sont importants, ou du moins les challenges auxquels vous aurez également à faire en mettant à jour. C'est l'engagement continu de nos autorités. Puisque nous avons vu un processus accéléré en janvier, nous avons validé le draft 0, en mars, nous sommes déjà validés techniquement, et dans les prochains jours, nous allons finaliser. Donc, il faut un engagement continu du ministère de la Santé pour soutenir vraiment le secteur de laboratoire. Si le ministère de la Santé ou les autorités n'accompagnent pas le processus, ça n'ira pas vite, parce qu'on sait que c'est eux qui ont toujours le dernier mot, c'est eux qui doivent autoriser la tenue des réunions, etc. Mais aussi entre les différents acteurs directement impliqués dans l'élaboration, il faut une bonne communication. Il faut que
also need a good communication. The stakeholders in the Ministry of Health and also the partners communicate well so that they plan things better and things will also be realized in a good calendar.
Alors, il est également
it's also important
que lors de ces
during these different activities, we should also have a good representativity of all the expertise that are present in the country. We really need to involve
la plupart, on ne peut pas impliquer tous les experts, mais les experts clés
maybe not all
du
the
domaine des
experts, but
laboratoires
the key
doivent être
experts
impliqués
in the
afin
laboratory field
d'anticiper
must
sur
be
certaines
involved so that they'll be
difficultés.
able
Par exemple, une des
to
difficultés qu'on a eues
foresee
lors de la
some
validation technique,
difficulties.
c'est qu'on s'est
The
rendu compte
difficulties
qu'il y
we
avait des
had, for
aspects
example,
qu'on
is
n'avait
that
pas
we
pris en
saw
compte,
that
ce qui nous aurait
we
permis
didn't
aujourd'hui
pay
d'avoir une
attention to
version
some
adoptée.
to
Si on
some
avait eu
texts that
impliqué
were going to help
certains
us,
acteurs qui avaient été
and if we
oubliés,
involve some
en ce moment, le
stakeholders
document aurait
that we
déjà
forgot,
sûrement été adopté.
maybe
Ce qui
this
fait que
document
maintenant,
was
on est
already
obligé
going to be
de faire un petit
adopted. So
rétropédalage
now
pour
we need to
s'arrimer
go a little
aux
bit
considérations du
backward
pays
so that
avant
we're going
d'adopter le
to
document.
take into account
Donc,
all the experts in the country and
l'un
adopt
des
the
points également
documents.
importants, c'est qu'il faut absolument
Of the critical elements
utiliser
that
une
we really
bonne et
need to
compréhensive
use
analyse
a
situationnelle.
very good
Parce que nous
analysis of
avons
the
eu lors
situation
de la révision du
because
document
during
à
the
revoir
revision
même
of
notre
the
analyse
document,
situationnelle parce qu'il fallait qu'il épouse certaines
reviewed
formes, il fallait qu'il
our
réponde dans un
situation
certain
analysis
canevas
because
qui
we
n'avait pas
had
été
to
pris en compte
respect
et l'éternel
some
problème
other facts that we did
challenge,
not. So the
c'est
challenge
l'optimisation des
is
ressources,
also
la mobilisation des
the
financements.
mobilization
On
of
le dira jamais
resources
assez,
and funding. And
nos
we
départements de
will always
laboratoire
be saying
manquent
it
parfois de
in our
financement et on a
department,
parfois
our
besoin
laboratory
du
departments
soutien des
sometimes lack
partenaires
funding,
techniques
and we
et
really need the
financiers pour nous
support of
accompagner
technical
et
and
même de mobiliser au
financial
niveau de l'État
partners,
de
and
l'argent.
also to
Mais cela demande
mobilize
donc une bonne préparation
financial
en
resources
avance. De tout cela
by the
donc,
state, but we
on a
also
tiré comme
need more
leçon qu'il est
planning in
important
advance. The
qu'il y ait un
lessons we
fort
learned is
engagement
that
des
it's
leaders du ministère de la
important to
Santé,
have
qu'il y ait une bonne communication
an engagement
et qu'il y ait un
of
bon groupe
leaders of
technique
the
qui va
Department
permettre
of
donc,
Health. We also need effective
d'élaborer le document,
communication.
qu'il est important
And
d'impliquer
we need a
les acteurs
technical
clés
working
et qu'il
group
faut
to
prendre en
prepare
considération
the
les
documents,
contraintes
and we need to
et les
take into
considérations
account all the
administratives de chaque pays.
constraints and the
Parce que vraiment le
administrative
canevas, que ce soit
situation
le
of all
canevas,
the
que ce soit
country.
le nom du
Because
document,
should it be the
ça
name
varie
of the
selon les pays
document,
parce qu'au début,
it
il faut le
changes
dire,
according to the countries. At the
on était dans
beginning,
l'imbroglio,
we
on voulait
were
écrire la
confused.
politique
We
des
wanted
laboratoires
to
et on
write
voulait écrire la
laboratory
politique qualité des
policy,
laboratoires.
and we also wanted to
Et
write
puis, en regardant les
quality
contraintes du
policy
pays,
of
on a vu qu'on ne
laboratory.
peut pas avoir
But
deux
according
documents.
to
Dans
the
les us et
constraints in
coutumes
the
de l'administration
country, we
camerounaise,
realized that we
quand on
couldn't
parle de
have two
politique nationale des
documents in
laboratoires,
Cameroon.
ben, il
When
faut
we talk
qu'on
about
intègre tous les aspects,
policy,
notamment les
laboratory policy, we need to
aspects
take into
qualité,
account
ce
all the
qui a fait
aspects
qu'on a
of
oublié
quality.
l'option
So we
d'élaborer une
forgot
politique
to
qualité à part,
we
mais
just
plutôt on a pris
stopped
tout ce qu'il y
having
avait
just
à mettre dans la politique qualité et on a
policy for
intégré ça
quality, but everything
dans
that
la
was in the
politique nationale des
policy,
laboratoires.
in the quality policy, we
L'une
included
des
it
leçons
in
apprises
the
également,
laboratory
c'est qu'il faut
policy.
une bonne
Another
compréhension
lesson we
du
learned is that we need
NLQF,
to
du guide.
understand
Il est
the
important qu'avant
NLQF
de
guidance.
l'utiliser, on
We need
puisse
to understand it
vraiment
before
le
using
lire
it. We really
et bien
need to
comprendre les
read
différentes
it
options
and
qui sont
understand all
proposées
the options
pour que
that
le
are
résultat
suggested
soit
so that the
bon.
result is going to be good.
L'analyse situationnelle
And
également doit être menée avec
situational
des outils
analysis must also be
conventionnels,
done
classiques, le LabNet,
with,
le LabMap, l'outil de
with
l'OMS.
the
Tous ces
tools of
outils, l'un de ces
WHO
outils, ça
like
dépendra des pays,
LabNet,
peut être utilisé et
LabMap,
devrait être
and
utilisé
according to
pour que
different
l'analyse
countries, but we
situationnelle
need to
soit vraiment
use these tools so
épouse la
that
forme du
the
domaine et
analysis of the
réponde plus facilement
situation
à certaines
is really going
questions.
to help us
Et
to
bien sûr, il faut
answer
tout faire
some
pour
all the
optimiser
questions, and
les
we also
ressources
need to
financières
optimize
disponibles parce que
the available
l'argent
financial
demeure le nerf de
resources
la
that are
guerre
limited,
pour
because
renforcer
money
nos
is
systèmes
the
de
main
santé à
thing that we
travers
need to reinforce
le
our
système de
health
laboratoire. Nous ne
system
saurons terminer
through
cette
laboratory
présentation
system.
sans
We
adresser
wouldn't
nos sincères
end our
remerciements,
presentation
premièrement à
without
notre
thanking, first
département
of all,
ministériel,
our
notre autorité
Department of Health
de santé du Cameroun qui au
of
cours vraiment de ces dernières
Cameroon
années
that
ont
has
pris
really
le
helped
bras
us during
le corps,
these
la
years,
responsabilité de faire
and they
aboutir ce
really
document.
took
Et
the
qui,
engagement
séance
for
tenante
these
même ici,
documents
nous ont même
to
envoyé encore
be
des
drafted,
demandes
and they
à
even
savoir où est-ce
sent
que se trouve
us
ce document
requests
de
to know
politique nationale
where are we in the drafting of this document. We also thank all the partners, all the departments that are partners, because we are now working with stakeholders from agriculture and also veterinary, and we also thank the partners that have accompanied this process, WHO and
particulièrement
especially,
à remercier
we would
Africa
like to especially
CDC,
thank
le
Africa
projet Resolve,
CDC, the
ASLM, parce
Resolve
que vraiment
project,
de janvier jusqu'à aujourd'hui,
CSR, because
ils ont
since
été vraiment cette petite
January,
épine qui nous piquait le
ASLM,
pied et
because
qui nous
since January
demandait
up to now, they were the ones who were
d'enlever
always
la
behind our
chaussure
back
qui nous empêchait
ask
donc
us
de faire sortir
to
cette politique. Et nous
remove all the
espérons vraiment
bottlenecks that were
qu'ils ne nous
hindering
lâcheront
this
pas et
policy to
qu'ils
be
nous
done,
accompagneront
and we
jusqu'à ce que
hope
ce
that they will
processus
never
puisse
forsake
aboutir.
us and they will
Nous
continue
remercions le
accompanying us
secteur privé,
until
nous
we're going
remercions
to
le
finish
monde
this document.
académique.
We also
Nous vous
thank private
remercions pour
sector
votre
and
aimable attention.
academics,
Merci.
and we also thank you for your attention. Thank you.
Thank you, Dr. Mbwe. So, ladies and gentlemen, we are at the end of our presentation session. The next session, or the rest of the day, will be spent going into our country teams and starting our country team work. So before we do, and before we say goodbye to the audience who joined us via the live stream, we'll have 5 minutes, just 5 minutes to take some pressing questions for any of the presentations that you have seen today.
Thank you so much. I'm Dr. Tosan Irabo from the Medical Science Council of Nigeria. I have 3 questions here. One is, how is ASLM, what is the strategy for ASLM to domesticate this SLIPTA project in country? Because when we started in Nigeria, when there were no donors to support, the program went down the drain. Then secondly, when Taferi was talking about accreditation auditors, once they finish the debrief, and maybe star allocation is set by those auditors. However, when it gets back to the secretariat, when the result is coming, some might not be the way it was debriefed, and this caused rift in the country. Then the third question is for the EQA program on AMR. I'm surprised that Nigeria is part of the AMR EQA, and I'm aware that in Nigeria there is a national external quality assurance which is accredited by SINAS. That facility is not part of this AMRF. Why is this so? Thank you.
Thank you very much. So I'll give the first 2 questions to Taferi. 1 minute, please, if you could answer that, then I'll answer the last one. Thank you.
Okay, thank you, Beatrice. Thank you, Dr. Tosan. On the first question, yeah, as per the instruction on the guideline, it is already made possible to own SLIPTA at a country level and move forward. And ASLM for this purpose came up, especially around 2018, we came up with the SLIPTA 2.0 strategy, which means the country team can lead, coordinate, and plan based on the available resource in the country, and then collaborate with the ASLM so that we can support them, guide them, and deploy the external auditors if all the locally available auditors would fall under conflict of interest. We can help in bringing auditor from the other neighboring country so that they can perform the audit independently or objectively. And for this, we've been announcing, communicating, and informing countries to own and move SLIPTA. But even though we introduced about the SLIPTA 2.0, most of those countries which has been participating in the SLIPTA program couldn't come up or couldn't be aggressive in terms of owning the program and moving forward, except few countries in East Africa. I would like to mention here because they need recognition. The countries like Tanzania, Uganda, and Kenya became very aggressive in terms of enrolling laboratories. Then Zimbabwe came up to own the SLIPTA program and move forward in terms of enrolling more laboratories. So it's possible and it's available. And the only thing that we need to do is we can communicate, and still if you need at the country level, we can clarify it.
All right, thank you, Teferi. So maybe during the tea break, we can have a conversation regarding the next question. Okay. Similarly with EQA, there have been several engagements with the Nigeria team. We work with the TWG in country, and I'll be very happy to have a side conversation with you about what we have done to engage Nigeria on the EQA program, the activities we've done to date, and how we're moving forward if you're not aware of these. So, but for now, we would like to just move on to the next part of the activity. So at the tea break, we'll be very happy to have those discussions with you. And just to say thank you very much to those participants. Pardon? Yes, please.
Thanks. Maybe I might want to elevate the question that my colleague asked and ask it this way: why have we failed to domesticate quality management systems implementation, and not just SLIPTA? And I think this is the reason why we are here today. Really to try and make sure that QMS implementation is happening across. We have had great experiences, but they are still dotted across the TH system in some labs and not in other labs. And I think the reason why we are discussing this national laboratory quality framework is to set the environment where we can now scale up QMS across the entire country. So instead of maybe saying, why are we not domesticating the SLIPTA program, I think we are trying to address this question differently to say, why are we not domesticating the quality management systems across the entire country? So I'm very keen. I think, like I said, this is going to be a very exciting 5 days because what we are aiming to achieve is to make sure that QMS is scaled up across. It's no longer a preserve for certain labs, but it's across the entire network and also bringing in all the other laboratory systems issues. So that is now the approach, really scaling up. So I'm sure that by the end of these 5 days, we should be able to answer his question and even give the countries that that capacity to go and really scale the QMS implementation across. Thanks.
Thank you, Mr. Ndlovu. I think that's a good point for us to finish these discussions. And we look forward to the next 4 days and having more discussions. So thank you very much to everybody who's joined us on the live stream. And we look forward to further engagements with you.